everyone. I'm Deborah McPhee, Dean for the Graduate School of Social Service here at Fordham University, and I want to thank you all for joining us for this very special event and helping us to celebrate International Women's Day. But yay! Most importantly, the Her Migrant Hub Spring Symposium. I think it was nearly 2 years ago, as I was reading, that this very unique initiative was launched, but really it's so unique because it was born of lived experience. Really initiated by women activists in New York City who really understand firsthand the experience of forced migration. And I think we have some of those folks with us today, so thank you for joining us. The vision was really to create a network of care, community advocating for the rights of women and asylum seekers. That brave vision and the dedication has really given birth to an amazing organization that has a lot of components to it, which you'll explore a lot of today, and you'll see a lot of the results. So thank you to those founding women and for joining us today. Fordham is very proud to be one of the partners that were forged of this vision. I want to thank you on behalf of our graduate students mostly who get to learn from a firsthand experience. They get to learn skills and knowledge being part of the initiative, not only from the women themselves, but from other activists and other grassroots organizations, an important part of their education. Of course, I want to thank Dr. Dana Alonso and Martiana Pescu for their important part of the partnership. They are two of our most distinguished faculty members at the Graduate School of Social Service and recognized internationally for their work in research and advocacy work in both migration and mental health. So thank you both for bringing your expertise and your commitment, but for also doing a lot of the work with the other partners of the Hub to organize today's symposium. So thank you. I really believe that universities, and particularly the School of Social Service, has an obligation and responsibility to make space for these kinds of events, to forge and facilitate these kinds of dialogues so that we can learn from each other. And so I'm very, very happy to be able to host today. The voices you'll be hearing from today, women, asylum seekers, activists, organizational leaders, service providers, students, professors, and other New York government representatives will really strive to help identify some of the current challenges that people in forced migration situations in New York City are facing. To learn about the challenges of the women from indigenous communities, from the access that they struggle to have access to resources, also but to share best practices of things we've already learned. So these are complex situations, they're complex experiences and complex solutions. So I'm thrilled that we have such a constellation of people here with us today to explore those. We're honored to have a number of folks serving as panelists today. I will not go ahead and introduce everyone because I know they'll be doing that themselves in a few minutes. But I do want to thank a couple of other essential partners. Primarily, I want to thank the Mother Cabrini Health Foundation for their essential funding and support of the Her Migrant Hub. The foundation is really dedicated to improving the health and well-being of vulnerable New Yorkers and bolstering the health outcomes for diverse communities, to eliminate barriers to care and to bridge gaps in health services. We have some representatives of Mother Cabrini here with us today. So thank you for joining us, and thank you for all of your support of the efforts. Additionally, there are several other New York City foundations, I think, invested in certainly supporting asylum seekers, and some of the representatives are in attendance today. Thank you for stepping up and sort of filling the gaps in important funding and support resources that are really necessary to keep the hub moving. I also want to thank Catholic Charities, the Archdiocese of New York. We have a long relationship at Fordham with the Catholic Diocese, our Catholic Charities of New York. Amazing organization. I've been proud enough to serve on the board for a number of years, and really always amazed by the work that they do. We have Kelly. I'm going to mess this up. Kelly Agnew-Barajas. Oh, thank you. Director of Refugee, Resettlement, Catholic Charities Community, Archdiocese of New York. She will be our panelist, our keynote speaker today, so thank you. So finally, I just want to thank our GSS staff, the folks that sort of put all the logistics together and run all the tech, Connor White, Trish Rodriguez, and Matt Roach. Thank you guys for all of the behind the scenes work. I know you will have an amazing day today. Thank you for participating. Thank you for all the work you do and for the difference that you make in the communities. And thank you for letting us host and be such an important partner. Thank you. Who's next? Marciana Perpescu.
Hello and welcome. We are very, very happy to have all of you here today. It's such an important day for us, and I think it is just the first step in working together and creating the synergy that is needed to address the complex challenges of the migration processes. We are in New York City, a sanctuary city, a place of safety, a place of welcome. We want to make sure that it is that place for everybody, and for that, everybody is needed. This vision came about 3 years ago, and Dana and I decided, okay, we need to try to launch this, and we got the support we needed. Thank you very much, Mother Cabrini. But the whole idea was to really start learning from the people themselves, the ones that are living with policies we create, with practices we put in place, with the mistakes we make, and with the best practices that we are working on. And 2 years and a bit later, we are here today to share some of the work, but also, because of this work, to bring together multiple people, multiple organizations that can make a difference. We have a full day, so I don't want to take too much of your time with continuing to talk. I can talk forever. My students know that, my colleagues know that. I'm good at this. But I'll stop right now, and it is my honor and my pleasure to introduce our keynote speaker. Kelly is not only a colleague and a friend, she's also a person I'm looking up to for her dedication and for all the knowledge that she brings to the table. She's the director of Resettlement at Catholic Charities of New York. She joined Catholic Charities in 2002 and has held various roles, working up the rank because she knows it. She understands what is happening. She's responsible now for overseeing social service programs for refugees, asylees, victims of human trafficking, unaccompanied minors, and other humanitarian migrants. Miss Agnew-Barajas was a middle school humanities teacher in New York City. She brings that to the table, understanding what we need to start educating children very early on. She also worked in San Diego Job Corps, serving youth with educational and vocational programming. She earned her BA in Cultural Studies and Education from Eugene Lang College of the New School for Social Research and has completed her MA in Cultural Anthropology and her Master's in Social Work at Hunter College, which, by the way, she already knew so much more. She just needed the degree. She is bilingual in English and Spanish, and she lives in Brooklyn with her husband and 2 kids, and she has a lot to share. So welcome, Kelly.
Thank you so much for that kind introduction. It's been really a true pleasure to be partnering with Fordham. The work that we've been undertaking together has been such a learning experience for me and my staff, and we look forward to many more years of partnership. So again, my name is Kelly. I am the Director of Refugee Resettlement at Catholic Charities. If you forgive me for looking at my notes a little bit, because I want to make sure. It's been a while since I've been in person giving a talk like this. So I thought it would be helpful to do a bit of a review of where we as a society stand in terms of the posture we have towards asylum seekers. It would be, I think, helpful to review the context, the recent history, and kind of what we have been through as resettlement providers. I still feel like I am emotionally processing some things from as far back as 2015. So the time that I have worked in resettlement, New York City, we've primarily worked with people who were already granted asylum, right? We're not a place where we resettle large numbers of refugees who are just arriving because, frankly, the housing is very expensive. But we've always worked with people who are granted asylum as our largest population. But is this loud enough? Okay, thank you. Is that okay? So very few resettle through the formal resettlement system here in New York City. So we have had, in the past, we've not had, rather, resources to formally serve people who were seeking asylum, and people who are still in their process. And if you know about the process to seek asylum, it can take several years. So I recall this one particular case that stands out in my mind. A woman from Pakistan had come into the office, not knowing where to start, how to begin the process. I would like to apply for asylum. Where do I even begin? What do I do? And we oriented her as best as we could. We've always, I said, have done the work at the margins, right? At the margins of our funded work, we did all this very important work, which, as a one person to another had to be done, right? Like you're not going to say, sorry, we don't do that. So we tried our best to connect her with legal services, which has gotten more and more and more difficult over the past number of years. We let her know that she was at the beginning of a long road. People don't have an idea of is this going to take a few days? Maybe I already have asylum? What's happening? They're not sure where they are in the process. We directed her to resources that didn't hinge on immigration status, like educational resources, food pantries, but it's very, very limited. So, me being someone who stays at the organization for a long time, 2 years later, she walks back into the office. Now she's won her asylum. But she got basically nothing during those 2 years, right? I couldn't be there for her. My staff couldn't really be there for her. So that had been something we had endured just time and time again. That's how it was. So toward the end of the Obama administration, there was a program that was launched as a pilot called the Family Case Management Program. It was intended to be an alternative to detention, which I think we can agree is a good thing, that people should not be locked up in family groups or individually. But it was intended, really as a compliance program. What does the government want to fund is programs to make sure that people go to court and from their vantage point do what it is that they want, accomplished, that they comply with court obligations. But from our point of view, we wanted to see, could we provide social supports as a way to support families, ensure that kids are in school, ensure that people have health insurance, et cetera, and that as a byproduct of that, they would be stable enough to and oriented enough to go to court and wanting to comply to make sure that they could see the process through. Unfortunately, the program that was very problematic, if you know anything about this, Women's Refugee Commission did a really good report on this program. Happy to send you materials later. But it was housed within the enforcement and removal operations, ERO, of ICE. So administratively, it was not well situated to be a trusted partner or have the credibility, right? Neither from providers like Catholic Charities or other nonprofits, nor from the community members if they got wind of kind of who this group was. So it was specifically the funding right was out of that body, and the contract was given to GeoCare. GeoCare is like a spin-off, feel-good version of Geo, which is a prison company, a for-profit prison company. So there was a lot of issues with this. In a sense, it was kind of in the right direction, but it had a lot of issues. The administrators of the program were prison professionals. They had no knowledge of the asylum process. So I remember talking to folks and saying, we've got this raft of clients. They're nearing their 1-year deadline. If you know anything about the asylum process, you should apply for asylum within 1 year of entry. They had, it was as though what I was saying, they just didn't compute. They did not have any frame of reference to place the fact of what I was saying within their experience. It wasn't a priority. They didn't really care, frankly. So I could wave as many flags, but it was not getting through. So after Trump was inaugurated, amongst the many other things that happened, this program was stopped. It was defunded. So, it was already problematic. I thought, it kind of had a glimmer where you could see something good potentially come from it, but it was stopped. So, getting to the Trump years, if I may, the rapid fire approach to deter asylum seekers, everything under the sun was thrown at this problem, right? So rather than see refugee crisis, internationally and globally and figure out what the response would be, how we could gear up to actually assist folks, no surprise, this was the approach. Unfortunately, we've seen, with Biden that despite statements when campaigning to say, we're going to really pay attention to asylum seeker issues, we have seen that very, very similar approaches and tactics have been employed and are planning on continue to be employed. So these tactics that under Trump include metering, which is a term that Customs and Border Protection uses for a process that limits the number of people that can request asylum at the border each day. Forcible return of asylum seekers to Mexico. This was known as Remain in Mexico, still known as Remain in Mexico, that resulted in unregulated refugee camps on the Mexican side of the border. Now about 71,000 asylum seekers, and including tens of thousands of kids, are living in unsafe conditions, no sanitation, very dangerous, at risk of trafficking and exploitation and all sorts of sexual abuse. Mexico will not invite the UNHCR or the Red Cross or anyone to come and say, let's address these conditions, let's kind of formalize this refugee camp. There's so many things wrong with the situation. The asylum transit ban, which now is going to have a kind of a resurrection under Biden. So this, forces folks who have traveled through another country to, that basically makes them ineligible for asylum if they've traveled through another country. So the only country that someone might be able to apply for asylum from would be our contiguous countries, Canada or Mexico. So quite limiting. Trump tried to just close the border with expedited deportation programs, extraterritorial asylum processing, interference of CBP with asylum screenings, and the list goes on. So one of the kind of sadly most controversial deterrence measures was zero tolerance or family separation. So DHS was considering a policy to separate women from their children to deter future asylum seekers from fleeing violence. This pilot program focused on El Paso and Ciudad Juarez. Adults who crossed the border without inspection were charged with a misdemeanor. I know you're familiar with this, but just to go over some of the details. When the adults were detained and they were criminally charged, the children were tracked through, I shouldn't even say tracked, they were kind of put on a track through the Office of Refugee Resettlement shelters. And the adults were then channeled through ICE detention centers or county jails. So this protocol was a dramatic departure from the previous policy, which called for families arriving together, seeking asylum, to be kept together. I remember, a few cases where a kid would come with their grandmother or their aunt and they would be still separated. This was like under Obama, but it was rare, so rare that they would not be kept together for the welfare of the child, for the best interest of the child. Let's see. So they pushed this simplistic narrative that if asylum seekers are fleeing violence and persecution, they want to keep their kids safe, they would be better off leaving their kids at home, which is a very, problematic notion that, that people have a choice, right? If people had a choice, they might be making different choices, but they don't have a choice. So this is the choice that people are making to flee. So the DHS secretary at the time, Nielsen, argued that parents who enter illegally are by definition criminals, entering our country illegally, often in dangerous circumstances. Again, the use of illegal immigrants have put their children at risk. As the American public became increasingly aware of this policy, she asserted that the increase in asylum seekers was as a result of loopholes in our federal immigration laws that prevent immigrant minors and family members from being detained and removed to their home countries. So she was referring to something that is a hallmark of a piece of legislation, the Trafficking Victims Protection and Reauthorization Act, which allows for expedited repatriation from contiguous countries, so Mexico, but careful screening of immigrants from elsewhere. So jumping forward a little bit with the beginning of COVID, which I know is still with us, but the enactment of Title 42 in March of 2020, which, was definitely a lot of other people were paying attention more to the pandemic, but this was happening in as early as March of 2020. The right to seek asylum has been largely suspended, with the idea that the ruse that closing the border was a protective health measure. According to the American Immigration Council, there have been over 1.8 million expulsions under Title 42. And this led to an increase in repeated crossing attempts. So when you're seeing, people will continue to try to seek safety, they've already made, a journey from their home country, and they will continue to try to seek safety, of course. So this brings us to the most recent announcement from February, from last month, that the Biden administration is planning to implement a new asylum transit ban, a restrictive border control measure that will penalize asylum seekers who cross the border in between ports of entry or who have not applied for protection in other countries that they have passed through. The proposal pays no attention to whether countries that they pass through have any semblance of an asylum system through which to apply for asylum. So in other words, if there is no real process to apply for asylum in certain places, that's not a factor. I didn't include this in my remarks, but there's some parole programs which are really quite limited in scope. I mean, they kind of sound good on paper, but they're numerically very small, as like kind of a throwing a bone to certain populations to build on a parole program. Anyway, so asylum seekers will automatically fail their credible fear interview, the first step in the process, if they can't demonstrate a severe medical emergency, some instance of human trafficking, or imminent danger. So there's a pretty high threshold of kind of getting through that first step. So these problematic repetitions are really imitating Trump policy in a disturbing way, and they violate international and U.S. laws. They violate human rights principles, and all of our laws say that people can apply for asylum no matter how they enter. If they enter between ports of entry, I mean, I've had in the past, there's one particular case that always stands out in my mind. He was a gentleman from Chechnya, but he stowed away on a ship. He had traveled all the way through Africa, all the way through Latin America, had false documents because he was fleeing for his life. This is what people have to do to find safety. There's nothing that says you need to come in this right way and use this app, and if you don't have a passport, that has never been the case in the past. The spotlight on asylum seekers shone brightly starting last spring here for more than it had in the past, as Governor Abbott of Texas rudely organized buses of migrants to various cities, including New York, DC, as an ongoing political stunt. So Mayor Adams, our own mayor, seemed actually genuinely shocked to learn that asylum seekers didn't have the right to work legally while they waited to submit their claims. I think you heard him talk. I mean, he was shocked. He was shocked. He was surprised. Asylum seekers, if you're aware, can apply for a work permit about 5 months after they submit their application. So it can take a while to even submit your application if you're going to do it by yourself or if you get an attorney to help you. Practically speaking, about a year seems what's realistic to actually get your work permit. There's a major lack right now of capacity in legal service organizations, and it's very expensive to hire a private attorney. So it can cost $10,000. I've heard, around that range for people who are seeking assistance from an attorney. And there are if there's no capacity, there's no capacity. So demand for creative pro se resources are at an all-time high. My colleagues that run legal services, including the Immigration Court Help Desk at Catholic Charities, they're at 26 Federal Plaza, but people are lined up around 26 Federal Plaza waiting in the wee hours of the morning to try to even get the basic orientation of how they might do the application for themselves, which is risky, right? Like doing it for yourself, you might make a mistake, you might not present things in the right way. So that even demand for that is sky high. We need more funding, we need more resources in so many different areas. So there are some exciting pilot projects. However, they're dwarfed by the need. So we need to start somewhere, I recognize, but it's frustrating. So when we first started, we have a funding, now we have a case manager who's here, hi Andreina, from the Borders Everywhere, which is funded through Catholic Charities USA. Last year, when we didn't have an assigned staff person on the program, we had MSW interns working on the program, which is for sustainability. It's wonderful, but it's also not a long-term solution. We had space for about 70 or so people that we could assist, and we got 130,000 referrals. So this is what we're dealing with. That's how many people were in the database. How do you choose from that list of people? How do you ethically make a decision of kind of who gets this help and who just all this rest of the people that don't get anything? So again, the government's main goal is court compliance, but we'd like to work on ensuring family stability, safety, health, education access, housing, to the extent that that's realistic these days. And we need to build much more capacity really quickly on these programs. Housing has just been the most persistent crisis. It's been like this for a long time, but it's at the point where everyone is just seems like they're throwing up their hands. To add to this crisis in the resettlement context, it's a kind of strangely underreported, but New York City is the top destination for Ukrainians in the country. So we have received, as a city, more than 20,000 Ukrainians thus far, almost all in Brooklyn, like 13 or 14,000 in Brooklyn, mostly Brighton Beach. But so there have been, of course, they do have status, they have a lot of advantages, but it adds to the sense of just, overwhelming volume of just people that need our assistance. So there's significant disparities and unequal treatment. Not to say that things are so perfect for the Ukrainians, because they are far from it. The Uniting for Ukraine program succeeded in bringing to date about 216,000 displaced Ukrainians just in less than a year, right? Uniting for Ukraine started late April of 2022. So the scale of the program can show there that where there's a political will and where there is some funding, that it's possible to do things and to bring people quickly to safety in a relatively organized manner. I have many critiques of the Uniting for Ukraine program, but I don't need to go into all the details. So similarly, right, in the previous year, right, the U.S. sprang into action welcoming 76,000 Afghans in a short period of time, very short period of time, opening up military bases, funding, rapid response programs. So that said, those people got out. There were, I hate to throw numbers at you, but for those of you who are paying attention to the numbers, after those folks that came out, there were 66,000 additional applications for parole from Afghans, of which only 8,000 have been processed, so a little more than 10%. And only, this number is so painful to say, only 123 have been approved. So again, it's like, we did that already. We're done with that crisis. Let's move on to the next thing. And we see that we need to be able to have our policymakers, do more than one thing at a time. So these responses, both the Afghan response and the Ukrainian response, have relied heavily on the use of humanitarian parole. I'm not an attorney, so for any attorneys in the audience, but humanitarian parole is not even a firm immigration status. It's not even a status. It's just like, you're paroled in, come on in, right? And they were added to the list of people that could receive certain services, benefits, etc. But it doesn't lead to a green card. It doesn't lead to a U.S. citizen. So ironically, it adds all of these people to the asylum backlog. Most of these people still need to apply for asylum. So the number of people in the asylum backlog right now is a staggering 1.5 million individuals. And these response programs, added their entire respective numbers, like almost 300,000 people to that backlog. It doesn't seem that smart to me. It was a fast reaction, but it also has long-term implications. So the intentions are good. Responses are swift in those cases, but the beneficiaries are on shaky ground. And we need acts of Congress for both to make sure that they can actually stay legally in the United States. They're not in deportation proceedings, but people feel very at risk and feel very nervous. So despite significant flaws in the response to these groups, there's kind of no federal coordinated response of any kind to ensure that asylum seekers are supported with their basic human needs. We have people coming to the office every day. Andrea, I don't do that as much as my staff, but they need diapers, they need clothing. There was, I don't want to cry. There was a little girl who came in. She was wearing pants that were just too small for her. They were like purple pants, like leggings. And I said, we're going to get you something. We're going to find something for her. And, WhatsApp on the phone with her mom. I'm going to get something for her. Gave them some other things, but we didn't have any pants that fit her. So we had to then, go out and get them. She started school. She had a new backpack that we were able to give her, but she had to wear these purple pants every single day to her whole first week of school. So then we saw her after that following weekend and gave her like 2 more pairs of pants so she could rotate, a black pair and a gray pair and the purple pair. But it's just, kids they deserve so much more. Like, we need to give them, basic services so that they feel comfortable and, part of our community. So the system we have to process asylum claims is overburdened. It needs to be reviewed badly. It really, the work done, it seems like nothing is done until the hands are forced at the very last minute. We have to comply with our obligations. Seeking asylum is a human right, but if there's no meaningful way to make that right a reality, it's totally hollow. We have to, do what Mayor Adams envisioned and make sure that people have a right to work. People want to work. People want to sustain themselves quickly. That's all anyone says as soon as they come in, how can I apply for my EAD? They don't realize that they can't. There is no way.
Actually, that system changed in the sense that among people who got paroled in can apply with a different category right now, right away. But the issue with that is that it's paid application, it's so limited.
For the paroles, right, the folks who got paroled, yeah.
But there is a way to do it for free.
They're, right,
They can do it.
yeah, of course, it's very complicated, there's so many.
People do that now, so it's a little bit easier, and in a sense, the passport used to be taken away most of the time. Right now, starting for the past 2 or 3 months, they're able to retain their passport, which is
Yeah, that's very helpful, right,
major change
Yeah.
because without documents, without documents.
100%, yeah, yeah. It's changing all the time, and the point is people,
C11 got covered even if it's limited.
Yes.
it helps
Yeah.
drastically.
absolutely.
Very nice.
So we also need to just, that whole system, right, needs to be streamlined. People need to understand what it is that they're doing. And right now, if they don't get legal orientations, they're kind of not sure what's happening to them, like where,
Personally, personal to apply with C11 and the waiver because $400 is a lot of money from that.
Totally. Yeah, it's astronomical, absolutely. So we have to also prioritize and streamline reunification of families. Not only people who are, here seeking asylum, but even once you receive your asylum, it can take years and years, to be able to reunify with your family. There's young kids, there's, all manner of families that really need to be kept together. It does no one any good in any part of the world to be kept away from their loved ones. We have some innovative ideas that are on this sponsorship model. The U.S. is experimenting with all sorts of different ways to implement sponsorship. I'm concerned with some of them. I think we need to find the right balance to ensure equity, access, accountability, and protection from exploitative situations, because we have seen concerning situations on sponsorship, from human trafficking concerns to, abuse and harassment. And there's also some ideas where, creating different pathways. There's people who can perhaps receive medical visas or expand on ways that, since we're at Fordham, right, expand on ways that people could study and have a visa to ensure that they're able to study and have legal status while they can continue their education. So since we're marking Women's Day, International Women's Day, I wish I had a white rose for everyone in the office, in the audience. Women or girls are impacted disproportionately in every single refugee situation around the world. 1 in 5 women experience sexual violence, including child marriage, trafficking, domestic abuse. The UNHCR reported that of the 100 million people now who are displaced, over half are women and girls, but their voices are largely left out of policies that are designed to protect them. So it's just like the Dr. McPhee was saying in the beginning, incorporating, making sure that women's voices are centered, and not making policies somewhere over here, right? Really figuring out what is needed on the ground is what is most helpful. Locally, our humanitarian response could be vastly improved by investing in legal assistance programs, providing coordinated mental health supports, which we haven't even touched on that. We're still at the, basic level of needing diapers, needing clothing, needing shoes, needing, Metro cards and housing, and just basic safety, food. And we are really not at this place where we're saying, how can we really support people to recover from their trauma? So as the issues we face as social workers, as practitioners in this field are daunting, very significant. Despite the many challenges, there are innovative ideas. And if anything, the spotlight, I think, that was shined on asylum seekers as a result of the bus migrants crisis created more awareness of the struggles that asylum seekers face. And this has created somewhat more public understanding about the differences between asylum seekers refugees and kind of what the needs truly are, because this is not a new phenomenon, but the concentration really brought a lot of attention in this past year. We don't want to ignore or push back the suffering of our fellow human beings. We must stand up for the rights of asylum seekers and refugees and demand that our leaders do the same. Thank you for having me today.
Thank you so much, Kelly, for sharing with us your insights on the complicated policies that govern immigration in the United States and the hoops and hurdles that asylum seekers have to jump through as they seek safety. You alluded to the impact that these challenges, these policies have on education, employment, and mental health. And we're going to spend the rest of our time together today looking at migration as a social determinant of health in and of itself, and how it relates to these critical areas. And we're going to start by looking at the impact of forced migration on mental health. And I'm going to invite our panel up here. We have the amazing opportunity to hear from individuals with experience of forced migrations themselves, as well as some amazing professionals who are supporting this population. And in a couple of minutes, they'll introduce themselves, and then we'll have a conversation around challenges related to seeking mental health care, as well as best practices related to providing mental health support for this population, what it is that social workers working with this population really need to know and keep in mind in order to improve treatment utilization and access to care. But I want to provide just a little bit more context and build off of what Kelly already shared with us before we get started and have introductions. According to the UNHCR in 2022, just under 90 million individuals were forced to leave their home. This is about 27 million refugees, just over 53 million internally displaced people, and over 4.5 million asylum seekers. When we think about what that means in just kind of concrete numbers, that's 1 in 8, every 88 individuals in the world forced to leave their home. Let's kind of wrap our heads around that for a minute. To bring that closer to home, in the United States, there are just under 2 million asylum applications awaiting processing at this time. 2 million. And since last summer alone, as Kelly mentioned, in New York City, about 42,000 individuals were bussed into New York, right, without any understanding of what awaited them and what services would be available to them. And while New York City threw together some emergency response and provided triage, water, urgent medical assistance, there was no support for psychosocial needs. And one might ask themselves why, after individuals have experienced such a difficult move towards safety, that mental health support wouldn't have been built into that emergency response, right? And perhaps it's that individuals who are new arrivals don't have access to mental health care or rights to mental health care. Well, in fact, that's not the case, right? Mental health is recognized as a human right, and all asylum seekers have the right to mental health care. And this is not a new process or a new principle or a new idea. As far back as 1991, the UN recognized this in its principles for the protection of persons with mental illness and the improvement of mental health care, right, which comprised 25 principles that laid out what access to care should look like, what the nature of care should be and the context for this care, and really emphasized that every individual has the right to health care that is humane and respectful and free of discrimination and aligns with the Declaration of Human Rights and other major international declarations and covenants. Sadly, progress was pretty slow in achieving mental health parity, and I think there's no country that has been noted right now to have parity between mental health and physical health care. And when we look globally, about 7% of health budgets is allocated for mental health care. And when we look at low and middle income countries, there's about $2 per person spent annually on mental health care. $2 a year. Imagine if we said that about healthcare. So let's think about this idea of social determinants of health that I mentioned earlier and how it relates to mental health needs of this population. There are two key assumptions that I wanted to highlight. And one is that it's widely acknowledged that there is no health without mental health. People with mental health conditions and those with psychosocial disabilities are known to have disproportionately higher rates of poor physical health and have a reduced life expectancy. For men, it's 20 years younger. For women, it's 15 years younger. So substantial. The second idea is that good mental health means much more than simply the absence of having a psychiatric illness, right, or having mental health impairment. And we know that social, psychosocial, physical, economic factors all play a role in helping individuals achieve their full potential, right? And we refer to these things as social determinants of health. And we know that when public policies do not support these preconditions or social determinants of mental illness, then it's not just a struggle for people who are currently dealing with symptoms of mental or psychological distress, but it's setting the stage for all individuals to, at some point in their lifetime, experience mental health impairment. When we look specifically at what the mental health impact is of forced migration and this failure to support social determinants of health for forced migrants, it's important to recognize, of course, that forced migrants are not a homogeneous group, right? And that disparate groups have different health needs and different risk factors. But there is some consistency in research that shows that when we look at forced migrants as a whole, there are dramatic increased risk for various mental health conditions, right? Starting with depression, moving on to anxiety, PTSD, and significant rates of suicidality. And it's not just related to one part of the migration journey. Folks think, well, yes, of course they had stressors. That's why they left their country of origin. But it's across the three phases of migration where we see these risk factors for mental health in this population. And so pre-migration exposure to violence, victimization, torture, trauma, significantly increases the likelihood that individuals experience depression, anxiety, PTSD. But we also know that the greater the exposure, the greater the severity of symptoms. During the migration journey, right, you can see ranging from stress resulting from uncertainty in one's future to lacking the ability to meet one's basic needs serve as significant stressors for mental health impairment. And of course, depending on the nature and duration of one's migration journey towards safety, again, severity of those symptoms will be greater. And then lastly, in terms of relocation and resettlement, factors related to acculturative stress, family conflict and separation, loneliness and isolation, and cultural and language barriers also serve as risk factors for mental health impairment, to the degree that the term lethal hopelessness has been coined to describe the suicidal thoughts of asylum seekers resulting from these factors. As part of Her Migrant Hub, Marciana and I had the honor of hearing from some incredible women activists who themselves were forced migrants and asylum seekers in New York City, who were willing to make themselves vulnerable and share their difficult migration stories with us so that we would be able to understand the barriers for help seeking, and the barriers for accessing mental health care and health care once they arrived in New York, and to look for opportunities to challenge these barriers and increase access and advocate for care so that no other woman would have to go through what they experienced. And what they shared with us were extreme rates of depression, anxiety, PTSD, increased experiences with interpersonal violence at home, and overall feelings of stress. And they also shared with us barriers for seeking help when they were experiencing these issues, right? Largely related to fear, right? What if I make myself known? What will happen? Will I be deported? Distrust of the medical system, right? This doesn't look like what care at home looks like. Right? How will they understand me? Cultural barriers. Can I find someone who speaks my language? If I do, will they understand what this migration experience is? To find someone who understands the experience of forced migration and speaks the same language, virtually impossible. Right? Not really even understanding where to go for treatment. And even if I knew where treatment was available, what will it look like? What does being in treatment even mean? And particularly difficult when mental health care at home was stigmatized, right, and seen as something negative. And then just a general lack of awareness regarding rights to care, all impacting help seeking, even when individuals knew, I need some help, this isn't right. So just from the women themselves, things that they've shared with us, they give you medication for depression, but they don't know why. They never asked me, why do you have depression? Doctors here don't always do what we expect them to do. It's done differently in our country. There are rumors that immigrants are being killed in hospitals. Months after arriving in the United States, I started with strange symptoms in my body and in the way of facing difficulties. I felt a tachycardia that started suddenly, agitation, dizziness, shortness of breath. I thought I was dying, and several times I had to call 911. I went to the emergency room very frequently, but they always said that it was okay for me to go home. Just a simple denial of care, even when someone's reaching out. I was trying to figure out why I was always sad. I thought maybe death was the solution, but I was not okay. I was going through depression, but I remember back home, depression was for weak or crazy people, but I was wrong. I was able to name each mental symptom I experienced: excessive paranoia, worry, anxiety, long-lasting sadness, and irritability. But I'm glad I'm using the past tense, as today my life is much better and I'm emotionally stable, even though I will never forget. So I want you to keep the words of these women and their experiences in your mind as I turn us over to our panel members to have a conversation around what can we do about these challenges? How can we provide better care to this population of individuals that are in great need of our support and have the right to receive it? So I'll turn it over to you guys if you want to say a few words about who you are and what you do and what your experiences are, please.
In just a second, there is a lot, like a more detailed description of every speaker you see today on your program, so we can, speed up and allow more time for content.
3 minutes.
Yes, I'll be very quick. My name is Rashmi Jaipal. I'm a retired professor of cross-cultural psychology and clinical psychology, and I'm currently representing the American Psychological Association at the UN, where I sit on the Committee for Migration with Marciana. And I'll just dive right into it. Some of the things, I just wanted to make a few points, which is that I'm looking up some recent research on the mental health problems for refugees, women refugees. One thing they find is that refugees have a rate of mental disorders that's twice that of migrant workers, and women, women apparently have more. Let me just get the study. They're much higher levels of PTSD and mental health problems than male refugees. What's interesting is that they, again, the kind of PTSD or the somatic symptoms, this kind of symptoms that they're experiencing, seem to have a lot to do with sexual-based violence. So that's something that needs to be taken into account when dealing with women refugees. Often they won't speak about it or say anything. It's very difficult. There are a lot of cultural inhibitions about talking about what they've gone through, and taboos, especially around sexuality and so on. So they will often repress or be unable to talk about it. But people who are service providers need to be aware that according to the research, and this is two review studies recently from 2021 and 2022 are showing that a lot of the PTSD is apparently much higher. Like one study found 75% of female refugees had PTSD compared to only 25% of the men. And these kinds of symptoms, like dissociation and so on with PTSD, seem to be related to, especially to sexual aggression and so on. And survivors of rape are more prone to PTSD than victims of car accidents, robbery, physical assault, combat, fire, etc., natural disasters. So the rape is actually the event most strongly linked to PTSD. So again, important to know this, that women refugees, if they're, again, showing any symptoms, just to take that into account, that, that could be it. And also an interesting study found that there are two types of trauma, they assessed two types of trauma, interpersonal trauma versus non-interpersonal trauma. Interpersonal meaning somebody who harms you in some way, rape or abuse and so on. Non-interpersonal trauma meaning the environmental deprivation, lack of food and so on, and lack of medical care. And they found that men, their PTSD symptoms were related to the lack of food, the non-interpersonal trauma, whereas for women, the PTSD symptoms were related to interpersonal trauma. So that was interesting because the women were not affected that much in terms of PTSD by the deprivation in the environment. Not, of course, they obviously suffered and had stress, but it wasn't linked to their PTSD symptoms. But for the men, the men were not affected by interpersonal trauma in terms of their PTSD symptoms, but the women were. So it's sort of interesting gender differences to do with gender socialization. So anyway, I think I should probably, I see, but I will talk much more about culture, because that's my background in culture and the acculturation process.
So I'll take the baton. My name is Seda Forsell, and I'm a proud Fordham graduate. I was able to have the privilege to study with these beautiful ladies here, and Marciana actually brought the activist out of me. Because I grew up in a very oppressed society where there were no activists. You can't be an activist. It's so dangerous stuff. And today I work at WJCS, Westchester Jewish Community Services, and I work at their Traeger Lamb Trauma Clinics. And I work as a trauma clinician and as a grief clinician, which was new for them. Believe it or not, trauma clinicians did not want to take grief clients. And I was like, no, these two go hand in hand. And when we talk about forcible migration, we not only talk about trauma, but we also talk about a lot of losses. Losses to death and losses to multiple other things. Loss of your language, loss of your land, loss of your house, loss of your clothes, loss of your family, loss of your childhood tunes, many things. And those layers and layers of losses needs to be also addressed. At WJCS, we recently received a grant to be able to work with kids between the ages of 8 to 21 who experience immigration-related losses. Hey, great news. I just want to say that, Rashmi described a lot of wonderful things and gave you a lot of numbers. I am not going to go into numbers, but I'm going to say that, hey, there's hope. There is hope. And PTSD can be treatable. And we need first safety to be able to treat any kind of trauma. So safety is really, really important. And one thing that we know that is really helpful for anyone with their mental health is resilience. Resilience has a big chunk in connection. Building connections, that's the most important thing, and feeling a belonging in a new land that you've never seen before and have no memories before, right? So there is hope. And here we are trying to kindle this hope, being together, creating connections among each other and among the women through the Her Migrant Hub. with the beautiful startup that I had the privilege to be a part of, coming together with my lovely friend here, meeting and supporting each other, learning together and moving forward. So there is hope. That's where I'm going to.
Hi everyone, I am a testimony of hope at CEDEF as saying, nice to meet you, Rasheen. We meet each other for a long time ago. Andreina Zuluaga from Venezuela and psychologist, but in my country over here, and I am an activist. I had a non-profit organization back in my country and also in New Jersey. I'm working and Catholic Charities as a case manager. My background is in mental health support. I think I take some notes, but I think it's also a lack of identity because in this migrant process we lost identity, and I say we because I am asylum myself. Um, I was all through this process, and that is hard because when you look for resources, you could find hope, and also you could find a community. I'm a proud member or this Her Migrant Hub project from the very beginning process. I'm thankful because I had the opportunity to be volunteer in an emotional support group for migrants, refugees, asylum seekers during the pandemic in RIF. Maria is there. So I'm pretty thankful for you for that opportunity. As a migrant woman, activist, and asylum myself, I just had this message that if you look for opportunities, then you will find opportunities. I also, let me see. Okay, I really think it is important to have a trauma-informed care because in this way, people could understand us much better. We had a mind that is different from this society, and sometimes our realities could like crash, but always is to try to find the point of like unity beyond difference. Even as migrants, we have different cultures, different nationalities, different beliefs, and we ourselves are different as a human being. So I think it is really important to understand our realities and try to be compassive with the other and be understanding. I think it is important to integrate ourselves in community because as that Dana mentioned, we had cases about suicide suicide. So we don't want people having this crisis, but it's his understanding. If they don't look for opportunities and beyond the medical system, like therapy and to talk, just to talk, to be heard, that is a space where we can build community, and we also can like run the extra mile because we never know we are looking for a word or a message or a resource. There are a lot of information, and I think when you look, you could find resource. So we are also creating a community in Her Migrant Hub. We had very important people there making this community from their own experience. We have women from different backgrounds, and Luisa had like the privilege or had this experience leading this group of women. They are from Central America, but we also had people from different countries. So I will pass the voice to her.
Thank you.
You're welcome.
Okay, my name is Luisa Fernanda Sandoval Cortez. I am a social worker. I am also a student at Fordham University and a PhD student, and working with Catholic Charities since 2 weeks ago. So I am very happy because of that. I also want to welcome my friends who are here from the Garifuna community. Hola. They are here, and I will be focused on talking about indigenous immigrants' mental health. I remember the first time we were talking in the group, I asked them about sadness, anxiety, and they told me in my country, in the Garifuna community, we didn't know about depression. We know we were not feeling well, but we didn't know this word depression, in Spanish, depresión. They didn't know about it. And I was, okay, how were you dealing with that? So I understood they have their own tradition to deal with depression, sadness, anxiety. And I understood also that they had also their own coping mechanisms that they use to overcome these situations. And they told me we have also traditional medicines, and we believe if we are sad, we can drink some teas. We will be better. So I was thinking, because it was the first time when I came here, I was studying my PhD. It was the first time that I heard about historical trauma. Here in the United States, you had been working with historical trauma, and I was thinking, okay, in Latin America we have a lot of indigenous, and they also have historical trauma. Perhaps I have also my indigenous roots in my family. So we have historical trauma, and those women, they have historical trauma, they have structural poverty, we have structural conditions that have affected also their mental health. And now they have to cross Mexico, they have to face those difficult situations, many of them that have been kidnapped. Some have living some also sexual violence there, and now they come here. They arrive here with all of those issues, and they start living the acculturation process. And this is also a difficulty because all of this is a mix that just create them depression, anxiety. They don't know what to do. They don't speak English. Many of them, they don't speak English. And they start living depression, anxiety, panic attacks, and post-traumatic stress disorder symptoms. So I have been learning a lot. I say to them, you teach me, always when I talk to them, because they teach me how they can get over these situations through these traditions, through these rituals. They also have some rituals, and they also have some dances. And they think through this process that they can, through these cultural processes that they have already in the Garifuna community, because I work with them, they can heal. So I will talk more about this later.
Thank you all. So I heard a couple of common themes as you were talking, themes of hope and resilience, and some of the protective factors that individuals might be able to turn to support them when they are struggling with mental health issues. And I definitely would like to hear us more talk about that. But before we get there, maybe we could start with talking about what some of the challenges are that asylum-seeking women in New York City face that might impact their mental health and their ability to seek care. And then we can perhaps switch over to resilience after. So I'm going to open up the floor to you guys. What are some of the challenges?
Okay, well, in my experience, I think the barriers of language is really important, because over here there are a lot of communities and organizations that bring help, but sometimes just people don't have access just because they doesn't speak the language. I think that is important barrier. The other barrier that I am experiencing from my workplace in this moment is a lot of people are confusing between coming to New York, like bused from the border, and they think they are already asylum granted. So or were, and I always clarify I am not a lawyer, but I had my own experience, but also working. So I think it is really important to give information, access to information. So barrier from language, access to information, just look for the right information. Make sure these people are like lawyers that could refer you in this process. Yeah, I think that is the most important. The other challenge is adaptation. We had to understand we come from a culture, and our culture is polychromatic, or we come from different like belief, and we come from different familiar structures, from a different culture. So we try to make like a little bit easy for us to adapt ourselves to this society, because people is really welcome in New York, but also we are like living in New York in a point. We know this city is rude, is huge, but if you make it in New York, you could make it in any place. So I think it's hard to, yeah.
How about others?
Well, to add to what you were saying about the cultural barriers, there are, for many community refugee cultures coming across that have coming from more traditional cultures where the male is sort of male is the head of the family and so on. Women carry the honor of the family with them. So the reputation of the family and their standing in the community rests with the female, the woman, and if she's seen as, and there's tremendous stigma around mental illness and mental health problems. So you're seen as, again, your standing in the community really falls if the woman is seen as seeking help for mental health care, or seen as having mental health problems. Again, women are saying, there have been some commentaries like her reputation will be very bad. It'll really affect the standing of the family, will go down. So that is a real barrier. One of the women say things like from Afghan women and Syrian women all say that a lot of them will not go for help. Even if they were open to going for help, they won't go because it's going to really affect they carry the whole reputation of the family with them. And the other thing is that in huge gaps in terms of how cultures conceptualize, or the idioms of distress, and how what is considered a problem, and what symptoms are, the symptoms manifest differently, as I think you were saying. Often the somatic symptoms, or dizziness, gastrointestinal problems, that kind of thing, they'll see that as that is their problem. It's not a mental problem, And so, but like that example you gave of going to the ER so many times, and she was presenting all these somatic symptoms, which obviously a culturally informed medical system would understand that and refer her to proper care, but no, they sent her back because nothing's wrong with them. Also, so that's the other barrier, is that the lack of understanding of cultural differences in symptomatology and idioms of distress, and then the cultural worldviews is totally different. And I loved what you said about the indigenous approach, and we can talk more about that. I just wanted to say there are lots of solutions if you think outside the box.
Yeah. And maybe we also need to talk about that people don't know resources, right? You're here for the first time, maybe you have no idea where to go, where to seek help. Yes, the emergency room might be a resource, but not a real resource. So I think from a provider's standpoint, I think we need to really be out there, really need to let people know where they can find help, and normalize it also as much as we can. And from, again, a provider standpoint, I think we also need to provide more and more education about trauma-informed care for providers and grief-informed care for providers. Because many of the time, people who have experienced trauma are misdiagnosed with other mental health issues. And that's really sad. Trauma-informed care is not very common, surprisingly. So that lens is lacking. And I think if we can provide that lens, not just to providers, mental health providers, but also to teachers, to nurses, to doctors, maybe even to security and police officers, that'll be lovely, right? And also, if we can have more programs that we can implement more trauma screenings, that would be very helpful too. And I also want to say one more thing about trauma screening, because many of the times, in my clinic too, we have referrals. And when we receive the referrals usually come with a brief history. And people really need to be trained well in trauma-informed care to be able to do a full set of trauma screening to understand where the traumatic events have happened. Usually when you receive someone who had to leave their country forcibly and come here, people tend to think that things happen on the road. Not necessarily. You really need to sit down, have an open mind, curious mind, to be able to listen. What happened to them when they were back at home? What happened to them on the way? And now what's happening to them right now? And trauma is not just acute trauma, right? It can be complex trauma. It can be racial trauma. It can be religious trauma. We may have many components to this. So we really need to pay attention, have an open mind, and have more trainings and sharing information, and hopefully more resources to provide. Thank you.
Thank you. So, Sedef, I hear you saying two important things. I think the first is, or perhaps they certainly relate to one another, but it's not just an issue of people not understanding where treatment is available, but even if someone does, once they access it, the quality or nature of the treatment that's available is often inadequate. And so there's a real failure in training.
I so agree. Yeah. And I'm happy to say that at least in Westchester community, now we're providing more trauma-informed care to teachers, to schools, and we have the funding, and we're working and pushing. And I know that, I'm hoping that we will have more in the city as well.
So I'm going to ask you in a couple of minutes to say just a couple of words about what trauma-informed care actually looks like. But before we get to that, Lisa, do you have...
Yes, I just want to add that in terms of challenge that women are living, what I can see is like shelters. I don't know. I mean, I have not been in a shelter, but what I hear, they say like we don't feel at home, and they say. Once Kimberly told me she has a little child, she said, I would like to bring my children's friends to home, but we cannot because we don't have privacy. Estoy hablando de la privacidad en los shelters. And they feel like they don't feel at home. And as a human being, we have a need of belong, and we have a need of having a home. I am an immigrant myself. I just changed my place, and now I feel more welcome at home. So I can imagine how they feel if they don't have privacy. They have to stay there. If they cannot leave their children by themselves, they have to, they feel sometimes, they say once, we feel we are in a jail. Sometimes. So it's like something important we have to know. Also, the lack of legal assistance is also stressful. They keep thinking, I need a lawyer, I don't have the lawyer, I don't have the money, so I have to pay the lawyer. It's like, and also, as a case managers, we feel like, okay, what can we do if we don't have also the legal resources to provide? And also the lack of mental assistance in their own language. They, as indigenous, they speak their language, Garifuna. We don't, I speak Spanish. So it's like, I can imagine sometimes they would like to speak in their own language and to express themselves. When I am sad, I just want to speak in Spanish. I don't feel like speaking in English when I am sad and when I am angry also. So it's like, yes, so it's also that I can feel with them. They have expressed me also the same feeling, like they want to express themselves in their ways they are used to express. So
yeah, absolutely. So in a way, what I hear is we talk about isolation being a risk factor for mental impairment, right, or psychosocial distress, and then we put people in situations where they are isolated, right, and they can't build social connections because they don't feel they have a home to do that in for themselves or their children. They can't reach the kind of support they need to be able to establish their lives, like legal support, and then they can't speak to people in their native language. To further isolation. So we have, I know, just a couple of minutes left. I'd love to target, where are the sources of protection for women asylum seekers in New York City? What helps with making this group feel welcomed in finding support and accessing care?
Go. Okay. Yes, I want to point out some resources. I mean, they even that if we don't have enough resources to provide, the fact that people are going to talk to someone is crucial. They feel like, oh, you are listening to me. Like, and yes, even that you cannot provide a legal resource, but you are listening to me. It's what happened. I crossed the Darien Gap, then I went through Mexico, thank you for listening to me. And I actually listen to people is like to look at to the eyes and listening, like pay attention and be Andreina said, compassion and empathy to people. I mean, I don't know what are you feeling, but I can just be here for you. And this time that if we have half an hour, I will with you. You are my priority, and it's like dignify people.
Yeah, it brings back a sense of
Yes.
humanity.
And also, this is important. I believe is my, it's not my expertise, but I believe like community, the power of community, community heal is what I feel. And also when we meet with the groups, I feel like through the storytelling and with the stories we hear and then we share some situation that they live here in New York and they have lived in Honduras, for example. And we have also people from Venezuela and from Colombia. And when we share these stories, they also heal and they say, oh, that's nice that you have lived the same situation I have lived, and now I know that I am not alone. So building community is powerful. And we need, as a social workers, we need, because social workers is, I strongly believe social work is political, and also we build communities. And also, I would like to point out that people have their own coping strategies. They have the individual strengths, resilience factors. They are so resilient. And I was like, sometimes when I am sad, I think, no, I had no. I mean, I am just worried about something is not really important because what they live is important. So I think that they teach me how to be resilient, how to be strong, and the social support is also important. What is their social support? We are a social support because we are building community, but they also have family, they also have friends. So and also people, their family who are still in Honduras. They talk to each other, and so there are some coping strategies and resilience factors that we have to take into account.
Can I piggyback on that?
It's like countering that isolation and recognizing strengths.
I just want to add what you're saying is so critical and important. And let's talk about how we heal, right? How we heal from trauma also. We talk about it and then we process it and then we integrate the memory of it in our brains. That witnessing is so critical, so critical. So it's wonderful to have that community, not only for having the belonging, but also being able to having the witnessing of our pain and stories and having the space to be able to talk and process. I was just going to say one more thing and I forgot that. Something else.
Yes, Andrea,
No, please go ahead.
just a quick 2 points to piggyback on everyone. That in terms of how a lot of the refugee women won't go for help because they feel more comfortable with their own cultural practices and traditions, as you were saying. And for indigenous women, and even for the other refugees coming who are non-indigenous, basically in low resource settings, you can actually use traditional medicine, traditional healers. I'm sure in the refugee population, some of the healers, and especially for the indigenous population, the healers who've come, they could be a tremendous resource for their communities, because I know the World Health Organization is encouraging governments now to endorse traditional and complementary medicine as a proper, treatment options. And the other quick thing is about the increase in domestic violence among, again, in refugee populations and immigrant populations, I think that any kind of empowerment of women, which it has to happen, has to also be coupled with some kind of treatment or empowerment or teaching for men in terms of how they deal with their loss of status. They perceive their coming here as they've lost their status, as change in gender roles, change in status. Women are being empowered, they're falling behind, they're losing their status in the family. So I think, and then they lash out in terms of increased domestic violence and so on, and they're feeling a lot of stress and low self-worth. So I think they have that, the male component also has to be addressed if we want to really empower women and empower the refugee community in general. So I just wanted to make that point.
Such an important point, because I think we also see there are major shifts in gender roles with women often finding jobs.
Yes.
Where they normally wouldn't be working, and then when feeling threatened in terms of being provider, and these major shifts have a tremendous impact.
Yeah.
I actually remembered what I was going to say. It was about empowering women, but from a different point. It was about, like, again, going through the, witnessing each other and then normalizing the pain that each other have. And at the same time, reflecting to each other that look how far you have come and you survived. And that reflection is so critical to be able to remind the women that they are strong. And when we feel that we're strong, then we can heal. So that's the thing I was going to say.
To close up, we are stronger together. I really think that there are a lot of resources out there. Pretty much the RIF Emotional Support Group is a resource. Her Migrant Hub, we are building a community. It's another resource. If you know something, just spread up with your community. But it is important to take our own history, to encourage and encounter and embrace that history, and don't feel shame and ask for help, because sometimes people don't really have access just because they don't talk. So we had to talk, look for the resource, and make more than network, como de valor. You know what I mean? Salud. So I think that is really important, and it's gonna be thoughtful and meaningful.
Yeah, thank you so much. Thank you so much for everyone taking the time to participate.
I love social workers. I really admire you all. You're doing the real work on the ground.
And you will see that I quickly moved behind Dana, and this is our Her Migrant Hub website. Actually, our web designer, together with a team of 4 members of the project, started putting together maps. So you see maps. Maps can be detailed based on what languages the services should be, what issues they are focusing on. So we're working on that. But as we are already a little bit delayed, I'm trying to kind of speed up the process. So I invite our second panel to come to the stage. So we'll have our second panel will focus on how can we make New York City a welcoming space, right? So we heard about health and mental health, and we're talking about social determinants of health all the time. And that I have a very projecting voice, so we talk about health, social determinants of health all the time. What we wanted to focus on is migration as a determinant of health, and looking at all these dimensions in which policies and practice are coming together, and where are the gaps? How can we fill these gaps? So this is what our second panel would be about. And Marty, can you also join us, please? We have a 4th panelist that will join the panel. And we do have, as I noticed, as I already mentioned, you have the description of our panelists, but we do have 2 amazing women from New York City Immigration Coalition. I'm very happy they could be with us today. And I keep getting information about the amazing work you guys do and resources created. So we're glad that they could join us. We have another amazing activist from Catholic Charities. Deb, thank you so much for being with us today. I know first time I listened to her, I was so inspired. I thought we need to bring her for any event we have. And then we have one of our own core members and activist, Marthy Kimday. And she's with us today. I mean, she could be on any panel because she has so much to share. But without further ado, I will ask you all to say in a few words, what do you see, based on your work and experience, as some of the challenges and issues we need to address to make New York City a welcoming and safe space for asylum seekers?
So my name is Marty, and as an immigrant, I went through a lot, and I have a lot of experience in terms of shelter, in terms of mental. What the first thing, according to my experience, I think New York City can do to bring those immigrants, these women immigrants, like to make them trust you, is a therapeutic communication. While you talking with them, don't ask them why, what happened. You can ask them what happened, but don't do an ending question with them, because it's gonna put them more in fear. So as an immigrant, when I came here, the first thing I was fear about is to go back. Like for me, someone would take me and go back home. And because as soon as I get in the airport, I was ready to give birth. I was bleeding, and then they take me straight to the emergency department. I didn't want to open my mouth. I didn't want to say anything to them because I was very, very fear, 100%. I can even say 200% that as soon as I finish giving birth, they would take me back. So when they was asking my name, I didn't want it. I hesitated very much until they bring a social worker. And then when she came in, I asked her, "Can I trust you?" My first question was, "Can I trust you?" She's like, "Yes." And I say, "Can I just be me and you?" And I say, "I want your badge to see if you're a social worker." She showed me. When I see that, I feel like something relaxed on me. And I say, "Yes, I'm gonna tell you the truth. I fled my country. We just getting in New York City, and I was even overdue when I took the plane. Supposed to give birth on January 26th, and I take the plane January 28th. And I bleed from my country to New York City. And I can't say I wasn't able to tell anybody on the plane, because if I tell them, they was gonna stop me on the next stop. So what I did, I was hiding my blood with the shit that you get on the plane to cover my blood until I told her this. I explained all my story to her. And I said, "Please make sure you're gonna secure me. Please make sure we're not going back." She said, "I promise you, Marty, you're not gonna go back. I promise you, I'm gonna make sure you feel safe here. And I don't know what you want me to do. And to assure you that you're going to be safe." I say, "I don't want to see any cops," because I was so scared about cops. "I don't want to see any cops." And she said, "They're here to protect you. No one will take you back." And this is how I really built up and trust with the social worker. And for my understanding, most of the social worker, if they have, for what I understand is, if they have a therapeutic communication, is gonna help a lot, because with therapeutic communication, you're going to help the immigrant to open everything for you, all the information. Let's say if you don't have the idea, how can you suggest someone? Let's say I'm going to send you a referral for this, if you don't know the issue of the person. The person have to talk. And to make her talk, you need to have a TikTok of how to make her talk, because they are so fair. And also, please, in the shelter system, many shelter, those who work on the shelter, sometimes they are kind of aggressive. More you aggressive with them, they close themselves. You don't know what they can do. They can kill themselves. I've been in the shelter for 4 years, and I see 4 suicides who went in the room and they killed themselves. Sometimes you went there, the food that they would give you, they would throw away for you, like to you. And you, at that time, you feel like you have no sense in this world. You have no benefit in this world. You can never be a better person. That's what I feel. And then the other person take just a fork and start stabbing herself and kill herself with a 7-year-old baby close to her. So it's very, very, I think, like, now a social worker, I know they already get the perfect training for that while being in school, but most of stuff in the shelter, they need to have at least 3-month training, honestly. 3-month training so they can understand how these people feel, how these people, listen, if you know the issue of a mental person, there is something that you will not going to do. The training those worker will help a lot to reduce suicide. Will help a lot to like PTSD, the mental issue. You listen, being with someone, talking with the person, giving them the whole, it helps them to heal. They're going to heal with their mental. When you feel alone, aloneness bring you up. It's gonna mix your mental. Like you're gonna be, oh no, I have no sense. That's how I feel. Like training is most important. Very, very much. It's very, very, very important.
Thank you, Marty. So basically, these are some of the issues that we kept uncovering, right? Housing issues. What kind of housing is needed for people arriving to New York City as asylum seekers in seek of refuge? Mental health services, where are they needed? What do we need to do to actually make them more accessible, but also make sure that people trust these services, because sometimes we have them and people are not using them. Please tell us what is being done. What are the challenges that you see and what is being done among service providers to address such issues?
Well, first of all, I want to say thank you for having faith in a social worker. It is a very safe environment to be with social workers, but that is not where I spend most of my time. I am the Senior Director of Case Management for Catholic Charities. For most of my time, I'm working with case managers that are interfacing with the shelter system or in eviction prevention, not in the safe haven of immigration providers who tend to be more compassionate. So I know what you're talking about from the perspective of the workers. I have a lot of numbers on this page here to make myself sound smarter than I am, but I am inspired by you and I'm inspired by what I heard from Luisa and Adriana to just stick with what social workers are. We know how to say hello, we know how to say goodbye, and we know how to conduct ourselves in between hello and goodbye. Our conduct is everything. I'm reminded of my mother always saying to me, Deborah, remember when you go outside, you represent this family. If you say the F word, that's on us. So when I look out, I work at the Navigation Center, which is with a whole lot of providers from city agencies. And I come out in the morning and I look out on the sea of 100 faces of people looking very despairing. And I always decide to say good morning. And some of them go, huh? And some of them say, buenos dias. You know, some of them will respond back and then there's a smile on their face. So I always try to remember to greet, to say hello. You never know if it helps somebody. I do hear at this center a lot of vitriol, which maybe in the field of immigration you don't hear a lot of because you're kindred spirits. There's a lot of animosity out there toward this population. What you've described in the shelter system, it can kill you, just like you described. We've had people who have come to us in substandard conditions in the shelter system. By the way, there's about 29,000 people in the shelter system, 22,000 in the DHS, standing for Department of Homeless Services, and another 8,000 in the HERCs, Humanitarian Emergency Respite and Relief Centers. Those are run by Health and Hospitals, and the rest are run by the Department of Homeless Services, the city shelter system. I think you're right about training, but I think it's also about recruitment. You have to have the right people in place. People have to have a heart who want to work in this field. If they don't, it's the wrong hire. And that you can't teach. Adriana and Luisa, they come to this naturally. They come to this with that in them. And I'm going to tell you one quick story about Adriana. We had a client at the Navigation Center, and the worker who saw her looked like a ghost. I said, what's the matter? She said, I can't believe what this woman just said to me, and I can't believe she doesn't know how to feed her child. I'm very, very, very worried about her. And I knew that Kelly had this program, and I reached out to Kelly, and I said, I think we have someone for Kelly's program. Turns out in the morning, she had been approached by the mental health provider. And when we said to her mental health service, she said, I don't need that. I need help. Little did she know she was talking to a mental health provider. So even that has to be done naturally and organically. Well-being, not mental health. It's stigmatizing. Anyhow, to finish my story, Adriana was called in, and she said, I will be right over. I said, who is this person who's going to be right over? Well, came the next week because the client couldn't stay. Adriana came over and I said, she's going to be very resistant, Adriana. She's very, very frightened about help. And Adriana said, don't worry. And she went up to her and she said, hi, you're coming with me. And the rest is history. She's still working with her. So it's all about what we know how to do well, engagement.
So much. And you know, I have to say, Andreina is part of our core group at Her Migrant Hub. So we are very, very proud to have her in all these other positions now. We all are claiming her. Please,
all right.
Liza and Andrea, tell us.
Great. Maybe I'll start us off and then Andrea will take it, which is how we always do things pretty much. So I'm Liza Schwarzels. I'm also a proud graduate of Fordham's MSW program. So I'm very glad to be back. I'm going to start by just talking about our organization for a second so you know where we're coming from. So the New York Immigration Coalition is actually a 200 plus member organization. So we have lots of members. Catholic Charities is of course a favorite. Who do direct service all across the state, actually. So we are kind of headquartered in New York City, but we do have offices in Syracuse and Buffalo. So we have people upstate working with farm workers, things like that, in addition to all of the things that we see, I think, at the city level. And we do a lot and mostly policy and advocacy work. So where we're sitting is sort of saying, okay, we're talking to the Catholic Charities, we're talking to the CBOs all across the city, and they're telling us, here is what people are coming to us, and this is what they need. And so we say, okay, how do we get this done? Where can we, where do we go? Can we go to the state? Can we go to the city? Who has the authority to do this? Who has the money to do this? And let's all remind ourselves, New York City is, I think, the richest city in the world. If not the richest, one of the richest, but I think it actually might be number one. We have the money, right? We have funding here. We could have more funding here, right? If we worked at it. But the point is, we're not lacking resources when it comes to the actual dollars. We're lacking the programs. We're lacking funding for specific resources that we need, right? One of the big, actually our number one campaign this year, and this goes back to what Kelly was talking about earlier, is what we're calling the Access to Representation Act and the Care for All Families campaign that goes with it. Something that a lot of people don't know is if you're going through an immigration court proceeding, you are in fact not guaranteed an attorney, right? Most of these people are representing themselves pro se. A lot of people don't know that because they think, oh, you're in a criminal court, you're gonna be, maybe incarcerated or maybe sent back, your life might be at risk. Of course, like everybody else in America, right? You get an attorney, when you're being charged with something. That's not the case. Immigration courts are civil courts.
Including for children.
Yes, including for children. We've had 5-year-olds, 3-year-olds sitting in front of an immigration court with nobody, right? With maybe there's somebody there who's holding their hand, but they don't even speak English, and that's it. That's what you're getting. So the Access to Representation Act, which is one of many campaigns that we work on, says that's not good enough. That's not good enough, and that's not what New York should look like, right? What we need is for every person who's going through immigration court, just like every other person in this state, they deserve an attorney, and we should provide one. And Kelly had mentioned, of course, that we don't have enough attorneys yet to do that. That's true. And we certainly don't have enough bilingual attorneys to do that. And I'm sure Andrea will talk about the language pieces that go into the education side of things as well. But we're really looking at a system that we need to build up over the course of years. But we do that by, again, talking to the attorneys that are doing this work, talking to the organizations that are rallying around refugees, and then we say, okay, so we're not gonna get every single person this year an attorney, but we can put $55 million, which by the way is nothing compared to the state budget in New York. And we can start building that up. We can start hiring those attorneys. We can start bringing bilingual attorneys, multilingual attorneys into the system. We can guarantee that we have a language bank and that we have language access for everybody who comes here, and not just for obviously legal services, but for hospitals, right? For schools, for all of the different places. We're looking at all of these things and we're saying, okay, how do we solve the problem with money and how do we solve it with law, right? We have the basis of what we need to do to fix these problems. We know what we need to do. We have wonderful social workers. We have wonderful professionals all across, New York State who know how to do what they do and they know how to do it well, but they can't just do it with nothing, right? So we need to get more social workers, more advocates, more community members engaged at the level where we're going to the state. We're going to Albany, we're going to Mayor Adams, and we're saying, it's actually not good enough what we're doing. We know what we need to do. New York is a super diverse state, and that is what makes us a great state. And, we should be investing in that, making sure that everybody also has those. And the way that we get that done is, again, by telling them that's what we need and telling them that's what we want to spend our tax dollars on, right? Telling them that, we can pay a little bit more taxes maybe if you have $3 billion in the bank account. We can afford to do this. So I'm going to stop there and pass it on to Andrea, who will probably be a little bit more specific. But
Yeah, no, hi there. My name is Andrea Ortiz, and I'm the Senior Manager of Education Policy at the New York Immigration Coalition, and I get the distinct pleasure of running our education campaigns in both the city and in the state. But as you may imagine, working in education means learning all the ins and outs of what affects a family and what affects a student who might be learning, which basically means all of their physical and mental health needs. And, it's really exciting to work for the New York Immigration Coalition because at the NYIC, we really deeply care about all of the issues affecting immigrant integration, including healthcare, mental health care, including legal services, language access, education, workforce development. But one of the things that I can say that, has been highlighted, especially during this last year where we saw a pretty large increase in newcomers, is how overwhelming all of the steps that immigrants have to take to be able to fully integrate themselves into our communities. There's just way too many steps, way too many agencies. And there's no coordinated services, right? We don't have systems that talk to each other, that open a door and make sure that once you go through that door, you get everything that you need. You basically have to find out about all of the things that you need to do and figure out where the lock to every single door is. And that just becomes very complicated. And many people give up in each step of the way, right? People give up in terms of getting their health care. People give up when it comes to enrolling their children in education. It's so complicated and so fragmented that it makes it very difficult for many families. And it also feeds into their mental health issues. But also our systems are just ill-prepared, right? There's a lot of biases that many of the counselors and workers that are helping our immigrants deal with this process. There's a lack of training. Folks have already said that. There's also bad information that's being shared out. Yeah, please.
Part of the problem is the social workers, when they consult people at the shelters on what's going on, it's based on the people with satisfactory immigration status, what they're eligible for, and a lot of times they're misinformed. Oh, you can get food stamps. No, you can't.
Right.
You're a citizen. And that's very misleading too, because people get the hopes up, they're desperate in the first place. They have no resources just to get here, cost them a lot of psychological and financial resources.
Right. And like you're pointing out, right, like your immigration status could make the difference between what early childhood program you're eligible for, what healthcare program you might be able to access. And if you're giving the wrong information or only a piece of the information, you're directing people to the wrong organization. We get day in and day out immigrants that come to the New York Immigration Coalition seeking services. They've been referred to us. We are not a direct service organization. And it breaks our heart, having to send immigrants away, because again, every step that they've been misdirected is one more chance that they will give up in that process. Right.
And social workers keep misdirecting them, and it causes a lot more frustration with mental health.
Right. And so bad information is definitely one of the things that we consistently see, and it happens in every single agency, right? So like you have bad information around the Department of Education and bad information about the health and hospitals and bad information over here. And so you have to do a lot of navigating and managing your expectations and how to figure out how to deal with this. On top of that, there's not a lot of in-language supports. There's not a lot of bilingual teachers, bilingual healthcare providers, bilingual social workers, and so we still need to work on the workforce issues. And just very quickly, of course, many of our families will need housing, will need food, will need a lot of their basic necessities met, right? They need to have coats and they need to have pants to be able to go to school. And so we also see that this is made worse by the fact that the community-based organizations, where they're more likely to get community and supports, they're underfunded, they're overwhelmed, they're not given enough supports. And one last thing that a lot of folks don't know is that many of our families don't know how to read or write in any language. And so it's very important for us to think about just how much of the process is done through paper, done through online forms, and in some of our communities don't even have written languages. And so it's just something that I wanted to point out as well.
Yes, yes, thank you so much. And you actually pointed out to my summation of everything you said, because I think what we hear is that we do need the knowledge, the know-how about how to approach people, how to start, how to end, what information to give, and how to make sure that information is accessible. Second, we need the coordination between all these services, which I think we were validated more and more through working with you, when talking about, okay, how can we bring all this information together, resources in different languages, the right accurate information so people are not misinformed, and then working with them throughout. And third is we do need a multi-level approach, because as we know, this is a very complex issue. So by changing, the only way in which we can change attitudes is by providing information. The only way in which we can change policies is by bringing this information at each level. I will just want to end with another last question for you, and then I promise you we'll take a break. We'll have a change in the program just to make sure that we relax a little bit before the next part. But if you would leave this audience in one sentence with what absolutely needs to be done, considering current priorities, what do you think needs to be done right now? And where can we come together to do that?
I believe for me is to fix the mental issue of immigrant. Mental issue. Fixing the mental issue of this immigrant will fix a lot of stuff. Example, suicide. Example, you see, certain people will take some stupefying, like smoke, just to forget their problems. They will smoke to forget their problems. You have a problem, you don't know who to talk, you don't know where to go. And sometimes they have the resources, but they have fear to go. They don't want to go. Some will tell you, no, I don't want to go. Guess what? If they have, if in that office there's, let's say, a person who speaks the language, they have chance to go. Then just pop up on a new word. For them is how they're gonna express themselves. Mental issue is very important. Mental issue is very for my understanding and for what I went through.
Thank you.
I guess I would go with the coordination of services, the coordination of care. Some of us work for bureaucracies, some of us are in grassroots settings, and some in the middle, small nonprofits. We have to pool all of our resources, identify what we each do well. Bureaucracies have the money, but bureaucracies are often prohibited from speaking to each other. And bureaucracies are just combinations of people. So we have to find the right people in those bureaucracies, not the bureaucrats who only want to preserve the bureaucracy, because that's where the money is and that's where the power is. Then we have to turn to the grassroots organization who have the freedom to do things out of the box, whereby bureaucracies don't. And in the middle, those small nonprofits that have really been the lifeblood of this most recent effort, clothes, food, water, everything, soup to nuts, those have been the places and the spaces who have reached people in ways that most of us have not.
Thank you.
God bless you for touching the heart of the problem. That's good.
Thank you.
Yeah, and I love this
Yes.
community-based organization piece, especially because, again, like these community-based organizations, they're coming from the same backgrounds as the people they're serving. So we are like, you're looking at organizations that are geographically located in the places where, families are living. I think earlier it was mentioned that most of the Ukrainian immigrants are going to the same area. That's because people group with the people that they know, right? So I love that. I'm gonna just say, call your representatives, call the city, call your state assembly members, call your senators, and you tell them, you say, we need access to representation. We need for our cops to stop working with ICE. That cannot happen anymore. We need to pass New York for all, right? You tell them we need coverage for all people. We need to expand healthcare to cover everyone and not just up to 18 and over 65 if you're undocumented. Everyone should be covered. So that's my short answer. You call and you tell them because they want to hear from you. And when you tell them that, they understand that this is what people care about. So you show up and you let them know.
Thank you so much. Second heart again.
Yeah. And since
Yeah, it's true. They point in the middle of the heart. It's true.
And since these beautiful people have already stolen my answers, I will just end with saying I think we need to change hearts and minds. I think that, and that's why it's important for all of us, those who provide services, those of us who are advocates, those are who are directly impacted, to speak up and be loud. Use our, teacher voices out there, our loud voices that we all have, and just make sure that we speak loudly about how wonderful our communities are and how much we bring, not just economically, because I know a lot of folks have this idea that we have to show with numbers like how important economically we are for this economy, but even just qualitatively, right? Like our lives qualitatively are better because of the immigrants that reside here. Our families are better taken care of. Our children are provided services and learning. We are able to get comprehensive health services, and immigrants build up our city. So I think all of us can speak up and speak loudly about how wonderful we are, and go against the narrative that there's too many of us, that there's not enough space, not enough housing. Because if we all bind together, I think that we can definitely make it so that we can provide the comprehensive resources that immigrants need here to thrive.
Thank you so
Very
much.
good speech. Appreciate it.
Thank you so much. And I can tell you, you continue to inspire me, you inspire us, and you keep us going. And we will find ways. Changing the image is one way. So while we are taking a break, pay attention to the screen, because what we will have is a video that was created by an amazing video animator that is today with us, together with women activists from Her Migrant Hub. And the intention is to actually educate, resolve myth, address myth and misinformation, but we'll go beyond that. We want to actually create stories that are appealing to the migrant population in different languages, that are appealing to the policymakers all the way to Albany and beyond, and that are appealing to service providers and to all of us. So pay attention to that. After the break, we'll have one other panel and a Q&A session. And then we have an amazing group of indigenous women that will share a little bit from their culture. That's another way in which we can start changing the attitudes. And then we'll move into the last part of our program. Thank you so much. But for now, let me introduce our third panel. And as we mentioned, you talk about the legal aspects, we talk about housing, we talk about mental health, but in reality, another top issue affecting the asylum seeker community is employment. Lack of access to employment, barriers to employment that link to that education. So our last panel will focus on these two social determinants of health, and we'll talk to these amazing panelists about these issues. But first, let me introduce the panel moderator, because it is my honor to introduce you, another person that inspired me to continue on this work, Dr. Tanzilia Oren, a fresh graduate of Fordham University. I had the privilege and the honor to be her dissertation chair. And she basically lived her life over the past 10, 15, 20 years, more, focusing on activism, focusing on forced migration, focusing on the rights of the migrant population. If anyone understands the asylum issues from within, really from her work along all this time, that's Tanzilia. When we want to, really get more information or be connected with more organizations, we need to talk to an organization that runs this kind of programs, it's Tanzilia that we are going to. So she's an amazing resource for all of us, and she agreed to run this panel. Thank you, Tanzilia.
Thank you so much. Yes, my background is a community organizing, so why am I always, the goal in such events is to connect people, to connect. So I say, Nurka, you have to speak to our community, like our new Russian speaking group here. So I think a lot of you are providers of services, and I hope you come up and introduce and chit chat with you. I think in-person event, we have to use this opportunity to make friends, because all of us are doing a super important work and doing the same thing, trying to help the asylum seekers from all different countries. Just want to make a note. I work with LGBTQ plus asylum seekers that were not mentioned so far. I just want to shout out and say there is this group of people from different countries who identify as LGBTQ plus, and this is a special group of very vulnerable asylum seekers. I specifically work and help develop a group that serve asylum seekers from post-Soviet countries. We are 15 different countries. I myself from Uzbekistan, and we have people here from our community, from Rusa LGBT. There is Alona, hey, there is Ola, there is Anya. So all of us working for Russian LGBT plus community. And so it's sometimes in the statistics when we lump people into men and women, like Spanish speaking, Russian speaking, this group get lost. We're not visible because the people cannot go to the community in Brighton Beach. Sorry, the diaspora communities are very homophobic mostly. It doesn't matter which country they come from. So that's the reality of the world, right? That's why, and the families often reject them, the parents don't talk to them, and mental health is much worse compared to many other groups. So I just want to highlight that the specific group I work with a lot. So today we talk about employment, our last topic. Employment and work authorization is the only tangible benefit, the only actual right that many asylum seekers get. Many, not all of them. So many asylum seekers can get work authorization. And Kelly told at the start of today that it takes a year, even more, just to get your first work authorization, though there are some exceptions that Anna is going to talk about. Also knowing that there is no federal response to asylum seeker support, so there is no budget, there's no public money from federal government going to support any asylum seeker, so the only thing you have is to work, to support yourself. The mental health is a giant elephant in the room. Many people come, they are not stabilized mentally, but they still have to work. So imagine this double crisis. You come with trauma, trauma back home, trauma of the transit, coming into the country, experience this trauma of no support. You cannot get food stamps, you cannot get that, this and that. So you don't have anything. So after a year, if you're lucky, you get your work authorization. So we'll talk today about what different organizations think and what they provide about education and employment to asylum seekers. And we have Isabel today from World Education Services. We have Nurka Melendez from Venezuelan Immigrant Aid. We have Anna Jaffe, is a community organizer and volunteer. And we have Andreina, again, from Catholic Charities. So can you talk a little bit employment as being the right for asylum seeker or not?
Me?
Yeah, let's start with Isabel.
We're starting with easy questions. Well, it is a right, for sure. As Tancilia and everybody here have mentioned, you are adding to the crisis if you're not allowing people to work. You're adding to the problem of them not being self-sufficient, of them having to depend on assistance that is really not there, and not being able to provide for them, for their families, maybe having to stay in shelters, which again is a system that's not providing the adequate care. Beyond that, not being an attorney, I don't think I can make a lot of comments. I do hope, and it was great for me to hear that Major Adams thinks that this is not ideal, and having been so surprised with the reality of asylum seekers not being able to work, he might be willing to do something else. I do have questions about the policies around that, and I would be interested in the Q&A in understanding more what the advocacy and policy advocacy opportunities are there. What I will say, just as context for World Education Services, well, we do focus on credential evaluations, which comes from the fact that the recognition of what people have done in their countries or in other countries outside of the US gets often, it's inadequate, and that creates unemployment, underemployment, so yet another issue. But apart from that, we do understand that the credential evaluation and employment is just one of the issues affecting immigrants, refugees, asylum seekers, and asylees. So we do work on policy and advocacy, and through our funding branch, we do look at issues that are more broad than that, than just the recognition of credentials. I think my fellow panelists might be better equipped to address the question of employment as a right.
Do we need to follow our own order? Okay, sorry. Well, hi, thank you for having me. My view is quite different because we work from, since 2016, being a young organization, we are turning 7 years in June. And what we know is this issue is not new. And it's quite, sometimes move your ground when you hear everybody surprising with a topic that it has been there for decades. Talking about the broken asylum system. So that is something that we have to keep in mind because it's not new. If you ask about the backlog, not just for the work permit authorization, but also for those who have applied for asylum and still waiting for the interview, we know that there are numbers such as 7-year waitings, 8-year waitings, 9-year waitings, and beyond my work permit that I have since 2016. I would like to know whether are going to be granted or not for asylum. That is something that we have to keep in mind. And from that point, from via our grassroots and volunteer-based organization, what we do is basically educate the community about what is the reality, despite of the desires and wishes that we all might have regarding how things will work, right? So knowing that, we educate people, we inform people about the process they must go through, beyond, again, the bills that might be in the Congress or might be in one desk that I don't know, maybe, thinking through the possibilities of changing this and changing that. But now the reality is that if you don't apply for asylum, you won't get to the point in which you can ask for your EAD, which is basically the employment authorization document. Trust me, that gives me plenty of time to say this. Then came, I think was last year in July 20 and 22, when the USCIS department announces that any of the people that are coming up to the US, they can get through their parole 212 D5. Everything is a nomenclature, to make things, harder to remember. But we do repeating this every single day, so we know that. So through that document, you can ask before USCIS your work permit authorization. That sounds really nice, but the reality again is that not everybody who is entering through this non-authorized port of entry in the US get that paper. That makes things even harder. Again, the idea is to inform people what is the right process they have to go through in order to, I know it's bureaucratic, I know it's slow, I know, but it's the thing that they have to do while desires and wishes and the thing that should be comes to a reality. So by saying this, I think beyond maybe creating in that traumatic world that we came with in our mind, with many thoughts that we had left behind, plus maybe creating false expectation can add more to our very busy, concerned mind and head and stuff. So I do believe in the human rights that every person or human has to be well informed. And part of that is to know what the processes are in the country. So that is what we do instead of maybe labeling or tagging stuff, saying, you know what, this is something that might come in the near future, midterm, long term, but now the thing that you have to do is this and that and that. ABC instead of jumping to the Z without passing through ABC. That is the thing from our volunteer-based community organization do every single week since 2016.
Hi, I'm helping with specifically with a lot of like Russian speaking, some not Russian speaking, LGBT border crosser. For the most part, they're good news and bad news. Bad news is since New York is in crisis in terms of an official work market, because what people get paid, I actually hear the numbers, they terrify me because they sound like numbers from 30 years ago when, I'm a refugee myself, so I remember working for cash for $3 an hour, but that was back in '93, which is very different, from where 30 years later, some people are getting paid. If they can find something, they find jobs for $4 an hour, $6 an hour, which is terrible, which takes them like 2 hours commute from their shelters. The way they get treated, I just don't want to mention it because, it's just really seemed to be like a very, very concerning situation and uncomfortable considering the trauma they experienced, both psychological and financial burden. It took people, for at least specifically Russian-speaking asylees, it takes about, it took them $4,000 or $5,000 to get from Russia to here at this point, and they're really not in a good psychological mental state. So, and they feel like they want to be working, making money, but that's not happening. And I heard even worse numbers for Spanish-speaking people, who come to work at construction and like they expected to get paid $3 an hour. I mean, just not that great. On the other hand, that implementation of this new rule, if people came through the border through official ports of entries and got their I-94s, that's amazing because until recently, I would say 90% of them got their documents taken away, passports. I believe at least in California, CBP stopped doing that. Okay, so they retain their passport. That's already a great help. Second of all, they can apply for work authorization right away, although their resources and their bureaucracy they have to deal with, it's difficult because those forms are paid and limited use. So they're most likely going to have about 8 or 9 months on them. After that, people should stop working because they're not going to be eligible for their second work authorization based on their asylum. And I feel it's a trick, it's a trap on the immigration office, because if people already started working, it will be very difficult and challenging for them to stop working. And if they're definitely breaking the law, and they can backfire when they get citizenship, because those 6 to 9 months they might be working using the document that's not legitimate, can be a big problem, because they're not going to pass a good moral character on the citizenship, and they might be denied their citizenship. And another thing is that limited work authorization is $400, which is a lot for most people. On the other hand, there is another provision right now. If you get means-tested benefit, which is Medicaid or HRA cash assistance, which a lot of people, they're not qualified because of the humanitarian crisis. HRA implemented some type of help. People get, I don't know, up to most people get $45 a month from HRA cash assistance, which is not, it's something, it's not a lot, but it gives them the official document that they're getting means-tested benefit that can help them to apply for with a fee waiver and remove that $400 fee from their work authorization document. So that helps. I helped quite a few people to apply. It's still in the process. We don't know how long it takes, but my estimate will be at least 3-4 months, and so they have about 8 months on their work authorization. It's still going to be legit. So that's what the situation is right now.
You also work with people every day, so what do you think about
Yeah. From my experience, I think it is important to put the real things on the table. People are asking me, I work with asylum seeker, and people ask me in a daily basis, should I pay for a fake social security number, even they bring this to the office? And it's like, they don't have the right to work legally, but people need to support themselves. People need to live. People need to pay for stuff. They are being underpaid because some of them work under the table for cash. So another people take advantage of them. So that is a reality. And as a human being, we know work brings us dignity. And all this American dream could becomes a nightmare for a lot of people trying to look for the way, because other countries people used to say, oh, you are doing great, you live in New York, you are making money, but this is not the way it is. We had this reality with the asylum seeker backlog, is people from 7 years ago waiting for a response. They don't even have a response. You are going to be granted or you don't. So all these wave or newcomers coming from the southern border, they are desperate and they don't understand the reality of the situation. I think it is really important to speak up and try to make something in a policy level. So try to make a statement, try to bring people together, people that is affected for this situation, and people who know they are able to work, they really want to work, but they can legally. But this is the other hand or the other version of the reality. They are working, but then they are being underpaid or abusing, trafficking. We don't know. A lot of situation could brings, and it's like a scenario to create more disorder than the one that we had. So I think it is really important to make activism and advocacy in this topic, because it is thoughtful and also affect mental health of people, because if they don't know there are a lot of women that they are eager to work, and I had some cases that we found a child care for the kids, and then they are like facing this challenge. How can I access to a work if I don't have paper? Then they had to pay 200, $300 for fake. So instead of that money go to fake stuff, why don't go to the government and then people be more welcome, and it's gonna be like a good way to make business also.
On a federal level, probably nothing will change anytime soon, but in the city, since Mayor Adams learning about the realities of asylum, so but the city can do like thinking outside of the box, right? Here, the community-based organizations, we have ideas about creating workers' cooperative, doing something that doesn't require federal work authorization to help people to survive. And you mentioned the childcare is a huge issue for many, many women. If we're talking today about women's rights and women asylum seeker, for many of us, the childcare is an unsurmountable obstacle to work. Knowing that if you work it undocumented, then it can affect your case. And then Anna talked about this new trap when, as a parolee, you apply for 9 months work authorization and it expires, and then you basically start accumulating this unlawful work that affect your future citizenship benefits, like putting people as different purpose, right? As different.
I think it's a trap. I think they do it on purpose because once you start working, who's gonna stop? I mean, people and your employer is not gonna check. So everything is visible. IRS knows about it. That's it. That's already a problem for the future because you're not gonna pass a good moral character provision. That's just not.
Saying that the policies cannot change when everybody, 99% of people want to work. And we say we cannot do anything. We cannot do anything every day. The city, we cannot do anything. The Congress, we are not going to do anything. But we have this 100,000 asylum seeker right now in New York City. Everybody wants to work.
Tansilia.
So I mean, it's like we are not talking. Like we cannot change. Mayor Adams cannot do anything. Like so, what we supposed to do then?
I have something to say about the childcare. I learned recently at the shelters they do have a special program for childcare because I have families with children. They can't do anything. They can't even go to the doctors because they have to bring the kids to school, come back. So they can't leave them for 1 minute because the ACP is going to be after them. So I believe they started providing vouchers, weekly vouchers for childcare. So I can probably provide more information.
You still have work authorization, even you find childcare, you still.
But you see, those parents can't even go to take English classes or any type of professional training, so it's going to help them a bit because they can move on with something. They're not trapped further by the fact they can't even leave a kid for 1 minute.
This information is not kind of widely popularized, right? So we know it, you know it, you maybe know.
I just learned it like a couple days ago. Somebody from the shelter told me, so I'm gonna make it as public as possible.
So we learned we learned from you that the city give very small like public assistance to parolees, right? But most asylum seekers don't know that. At least to get something money for MetroCard to travel, right? So
most of them qualify for fair fares, which is discounted half-price MetroCard. You can apply right. You don't need anything. You just apply. You put your homeless. You get it. Well, you need an address to receive it, but that helps. Okay, even with a small amount of $45 they give to, at least there's a fair chance of for people to get. Can at least cover something because so many times I heard that people can't even go to take care of their documents or go to this HRA because they don't have fair money. That's how bad it gets.
So the point here that employment is not a right for asylum seekers. It's not. Though it's the only possible tangible benefit because most of other benefits, it's a huge bureaucracy to get anything to help. If you live in a shelter, you have small children, it's almost impossible to get and do the job search, find something. So this is not a human right. So this is something for us, kind of today's event, also to finish that. We had an event recently with World Education Services, and people got pissed off at me saying, because several organizations were saying, we don't serve asylum seekers directly, but we train the trainer, and we train the providers how to know your rights training. And I came out and I say, so what kind of rights asylum seeker have? Explain to me. I work with asylum seeker for 50 years. Please explain to me what rights they have. And people just, instead of replying to me, got angry, saying, oh, you don't know anything. Okay. When I mentioned LGBTQ, another organization stopped talking to me, completely blocked me on email and text. We're used to that. So this is what we face as providers. They shut us down, they don't provide answers, and they are homophobic among providers even, like blocking me specifically because I mentioned LGBT.
I have an experience, but I would like to hear Isabel because she was about to say something.
Yeah, so I want to bring it back to what Tansilia said that to what Tansilia said about people, asylum seekers and asylees wanting to work and not being able to work. At the same time, we heard from Liza, I think they may have left, Liza and Andrea, about how much lawyers are needed. And we know, just as it was in the pandemic, when we needed healthcare professionals and they were sitting, many immigrants, many refugees who have that kind of background sitting on the sidelines because they were unable to work, not authorized or not recognized in their skills. And the same thing applies here. While everybody brings amazing things, when we're talking about needing the people to care for them, for their communities, the lawyers who speak Spanish, who speak Ukrainian, to help their community, they may be here already, and we're just not letting them help because we're not recognizing their skills. We're making it impossible for them to find jobs where they are going to be able to do this work. And at the same time, we're denying them work permits that are going to allow them to have those professions and those roles that where they could be using those skills. So I hear you, Tansilia, and it's really bad. And it's so sad that Major Adams cannot, by fiat, change things. But there has to be something that those who are serving asylum seekers and asylees and everybody else who's a migrant can do to bring this to the attention of people, that if on the federal level and on the state level things may take much longer, what options are there? And really it's a lot of it starts with creating that awareness and being able to have these spaces where we can all agree on the fact that the talent is here, everybody brings something great, the need is here, and we're just not connecting those two realities.
We went over the time. I apologize. I'm sorry. When I told Marciana, don't invite me to the panel, people will not like what I'm going to say. Always making big noise and crazy statements. But thank you so much to all the panelists, to Rachel, Nurka, Anna, and Andreina. Thank you so much.
Thank you, Tansilia, and thank you all. And we need people that are saying crazy things, disrupting the policy processes and disrupting the status quo is what we want to do. It's on us. So we all have to do that. Thank you so much. We do have a slight change in the program because we decided to make sure that what needs to be heard is heard. So, and also less is more. So instead of rushing to get to the working groups, we might have a second event just to really work together on policy issues. We will now give the floor to an amazing pair of women that are representing the indigenous community. And they will share a little bit of the culture they represent and a few words about their own stories. After that, we will have a resource fair in which you can go and see some of the resources, and we'll play here some of the resources we have so you can see that. And then we'll have a closing moment and we'll point to some of the issues that I hope we can continue to work on together. With no further ado, we are inviting our indigenous community women activists to the front, And you all got some devices. Please make sure you return them at the end. So you can listen if you are not a Spanish speaker. We do have an interpreter that will help us all understand.
So for the people who got it turned off, all you have to do is turn it off with the middle button and then just put the headphones on, okay?
Buenas tardes. Es un placer saludarles. Somos de la comunidad inmigrante del país de Honduras. Una vez más, bienvenido. Mi nombre es Carol Álvarez y estamos aquí en representación de la cultura garífuna. Si bien es cierto, tenemos un flagelo muy grande, somos inmigrantes y carecemos mucho de la depresión como comunidad inmigrante. ¿Qué les quiero decir con eso? Desde que pusimos un pie aquí, no ha sido nada fácil. No ha sido nada fácil para cualquier cantidad de inmigrantes. Hemos pasado diferentes procesos, obstáculos, pero también al mismo tiempo podríamos decir que es un reto. Si bien es cierto, hemos pasado cierta cantidad de situación, pero eso también nos ha venido a fortalecer. No podemos decaer porque finalmente están nuestros hijos, están nuestros padres, y también queremos hacer un llamado al gobierno que nos apoye con nuestro asilo. La real verdad es que estamos aquí para ver en qué nos pueden apoyar y para saber sobrevivir en nuestra comunidad y tanto aquí. Venimos de un país que de repente nosotros carecemos de tantas cosas y hoy en día aquí como inmigrantes descubrimos. En mi país no sabíamos lo que era depresión. Aquí venimos a descubrir lo que es la depresión. Entonces nosotros carecemos mucho de eso allá en nuestro país. Y ya hoy en día pues ya descubrimos qué es lo que nosotros tenemos. Necesitamos apoyo psicológico, mental, porque de esta manera podemos progresar con nuestros hijos, porque esto nos afecta a nosotros y posiblemente pudiera afectar a nuestros hijos. Entonces, ese es el punto que yo quería agregar esta tarde. Les cedo el puesto a mi compañera.
Sereme. Buenas tardes a todos. Mi nombre es Janie David. Soy de Honduras y soy peticionaria de asilo. Actualmente tengo 2 hijos, tengo una familia y como llegué aquí un poco de Estados Unidos, tuve que huir porque la comunidad garífuna está siendo amenazada por su territorio. Eso nos obliga a nosotros a desplazarnos a otros países para buscar oportunidades porque no hay seguridad a la integridad del ser humano. Y como defensora de tierra y territorio, tuve que huir por mi vida. Es por hoy que ahora le doy gracias a Dios por llegar a este país y por encontrar también la organización Her Migrant Hub, por el apoyo incondicional que nos está dando a las mujeres buscadoras de asilo, que necesitamos que el gobierno nos escuche y que pueda apoyar a estas mujeres que huimos de nuestro país, pero no queremos ser una carga pública. Nosotros queremos trabajar. Y es por eso que estamos pidiendo de que se nos pueda conceder el permiso de trabajo. No queremos ser indemnizadas. Tenemos manos, tenemos pies y queremos esforzarnos por nosotros mismos. Tenemos hijos que formar y no queremos ser una carga pública. Es por eso que llamo de que las prioridades sean igualitarias, como lo decían las compañeras. Cuando tú llegas aquí a ese país, se te prohíbe o las reglas no son las mismas. No tenés un permiso de trabajo y te obliga a quedarte con tu hijo, porque es demasiado el costo que hay. Entonces, por eso que nosotros estamos hablando esta tarde de que las oportunidades sean igualitarias, por lo menos. Que eso nos puedan dar esas oportunidades para que podamos salir adelante y que podamos también ayudarle a este país adelante, porque el inmigrante trabaja de día y noche. Entonces no queremos ser pobrecitos, queremos valernos por nosotros mismos. Y un poco también en la actualidad, todas esas mujeres que tenemos, es por eso que estoy aquí hablando por ellas, hablando porque son muchas que no tienen ese permiso de trabajo, que les urge huir. Pasan una depresión alta, que no saben cómo se encuentran. Entonces necesitamos que el gobierno nos escuche y que agilice también ese proceso. ¿Qué pasa con las peticionarias de asilo? Se te termina el permiso por 2 años y te obliga a ti, si estás en un trabajo, pararte porque no se te ha renovado ese permiso de trabajo. Y creo que no es permitido, ¿verdad? Deberían de ser que las cosas vayan un poco rápido, porque ¿cómo es posible que tenés un buen trabajo y te tenés que sentarte porque no te lo han renovado? Creo que no es justo. Necesitamos políticas equitativas, esas políticas justas que estas mujeres, esos hombres, esos niños necesitan una oportunidad. Si estamos en ese país de la libertad, entonces que la libertad sea para todos. Sereme Nia Home, Puiti Rabawi. Gracias a todos.
Quiero recalcar algo, enfatizar de lo que decía la compañera Belinda. Yo creo que como comunidad garífuna debemos de ser escuchados. Algo muy importante que me llamó a la atención, se trata del asilo. Muchos de los compañeros o compatriotas, podría decir, estamos preocupados. Y hablo en general. ¿Por qué estamos preocupados? ¿Qué pasaría si no ganamos el asilo? Tendríamos que apelar. Para poder apelar, muchas veces se necesita el dinero y no tenemos aquella cantidad de dinero como para apelar. ¿Y qué nos acerta a nosotros si en verdad lo podemos ganar? ¿Qué pasaría? Es una duda que como comunidad inmigrante todos los tenemos, mas sin embargo lo callamos por el temor. O a veces no accedemos a un abogado para preguntar qué está pasando, qué pasaría. Porque no simplemente es algo complejo. Cuando estamos dentro de un abogado, estamos no exponiéndonos, pero estamos exponiendo nuestros casos y hay una decisión. Y la decisión sería sí o no, y quien la determina es el juez. Entonces, si el juez nos dice, no, tú no aplicas para un asilo o te niegan el asilo, ¿qué va a pasar? O sea, nos vamos a nuestro país a arriesgarnos de nuevo, porque venimos de allá siendo amenazados y dejamos una cultura rica, porque la cultura de nosotros es muy rica. Simplemente eso y sereme Nia. Gracias.
Bueno, gracias a todos por escucharnos y les reitero, ¿verdad? Oportunidades equitativas para todos. En ese mes de la mujer necesitamos que las cosas se escuchen, que se alce la voz de la mujer. Es necesario más oportunidades para que nosotros podamos salir adelante. Basta ya, no podemos callar. Ni una menos, ni una más. Sereme Niejo. Vamos a cantarle una canción más o menos para que sepan vamos a cantar el parranda. ¿Por qué se usa la parranda? Es la liberación de la mujer. Hace cánticos para que se libere, cánticos cuando se apropian sus territorios, cánticos cuando está siendo amenazada la mujer y canta para que se libere y pueda expresar ese estrés en cantos. Narenga home se biamadam bunie ayanu hanuma go ligili siruguginye biamadam bunie ayanu hanuma go ligili siruguginye linaru irumonie anyare la nege tanina ligilise anyare la nege lanina putare ke gubeir gunuguya Move banya haro.
Mabunu banya.
Move banya haro.
Mabunu banya.
Huchagu wargu banya harani baguno.
Gaisi baburene.
Narudunale. Liari tiempo. Shilhadina. Yaramunada. Shilhadina. Yaravabie. Silviani turavo. Mabula chala. Lira baguira. Natigura meteño. Lugura babago. Liru tabaruni baguchutu malale. Tira veina ariebo. Ninarubao. Gudeme tunu. Idavabame. Ilame la chuluru tuwe yuri mama tu. Sube familia. Valugu babarige. Sube familia. Valugu babarige mama. Sube familia. Valugu babarige. Oh. Ay, 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 ma. Mama nugu churo. Valugu babarige. Ay. Ay, 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 ma. Mama nugu churo. Valugu babarige. Seremi.
It's hard to follow such an act. We had a few conversations and a few times in which we were telling them, you are the leaders. We are working with a group of women from the Garifuna community. And Carol and Belinda are really leaders in that community. You know, like, I mean, these speeches, they can reach many places. We just need to make sure that we create that access. So, any questions or comments you might have for the panelists that are still with us? This is the time.
Hello. This was one of the best presentations I've been to. It was really very comprehensive. And I was thinking about somebody, I think she said something about having a coordination of care, something like very comprehensive that we deal with all the needs. And I was thinking about like centers in the city that we use the model of the psycho-education to have everything in one house, maybe in different boroughs, to deal with all the needs, to inform the immigrants and actually the refugees as well about the issues that they're going to experience. Contact with ACS has been a traumatic experience for some, so they need to know. Contact with schools, the churches, everything, the police. So if that's a gap that needs to be closed, I think it should be with people that the center should be linguistically and culturally appropriate for whichever community that assesses it. That's what I was thinking. Other than that, this is the fantastic presentation.
Thank you so much. And yes, coordination of care, having a comprehensive approach. We cannot deal with complex issues by siloing ourselves and working in silos and just trying to put a patch here and a patch there. We need a more comprehensive approach and we need to create more synergy. Anybody else? Questions? This is how I get my steps in.
Thank you. So if everyone please help me giving the equipment back to either Andreina or Luisa. And I am an interpreter. Actually, I've been working as an interpreter for immigration asylum cases. My name is Tatiana, and I've been doing this for about 10 years. Once the pandemic started, basically, we weren't able to get in as an interpreters. And most of the time, we were actually the only people accompanying these asylum seekers. So I have been able to see everything. People fainting, ambulances, deportations. I have been able to see people crying there. I have been able to see the bias from the officers. And I have also experienced how the kids have to stay there for about 5, 6, 7 hours during that asylum interview. So with this, I just wanted to say that in March 16, there is a change, and apparently interpreters are going to be able to go back to accompany these asylum seekers. So I just wanted to remind everyone so that you can pass this information along, because if the asylum seekers that are going there on the 16th go without an interpreter, they are not gonna be able to have the interview. I believe it's important that interpreters are with them, because most of the time, attorneys are not with them. Most of the time, their families cannot be with them. Most of the time, it's just the asylum seeker and the interpreter. So we are kind of a liaison / advocacy kind of person that is helping them. So I can leave my information there at the resource center if you have any question. Oh, okay. That's it. Thank you.
Thank you so much. And we are so happy we got to meet her because this is such an important resource. Language barriers are some of the most problematic barriers we have. I'm running to you. Oh, but you know, it's healthy.
Good afternoon. My name is Olive Taylor. I am a family team conference facilitator for ACS, New York Children's Services. I'm also a clinical social worker. So if some of the representatives from the agency, if you will give me your contact information, I will speak with my leadership and I will arrange at your convenience, if we can arrange training for those of you who work as advocates. One thing that I do know, because I also do some immigration mitigation work on the side, a lot of the families and children that encounter ACS are afraid because they think that ACS has an obligation to report them. That is not the case. A lot of the immigrants who come to interface with ACS, a lot of them are seeking asylum because they have been survivors of domestic abuse, sexual abuse, some trafficking, and they may have run into some issues regarding the children. And because they don't understand how things work here, they're often anxious. And sometimes, I don't know, I see some of you guys shaking your heads. I don't know if you have worked with people who have interfaced with ACS and had to go through a child safety conference. So at the child safety conference, there is a facilitator. That's what I do. So in addition to ensuring that the conference flows within the time frame, it's also my obligation to not only document what happens, but to offer objective resources and assistance. One of the things that's very helpful is the inclusion of a parent advocate. Parent advocates are contracted with a few agencies. They don't work for ACS, they strictly work for the parent. And what they can do is they can be an advocate or resource for the parent during the conference. And it also helps if they speak the same language, because having the language familiarity goes a long way. So like I said, I'm not in a position to do anything right here because that's above my pay grade. But if you will provide me your contact information, I will, when I get into my office tomorrow, I will reach out to my leadership because they did give me permission to attend this. So I will reach out and see if we can set up something where you can get some resources, additional information, because there is a lot of information out there. We have family team conference information. We have information about what happens in an investigation, and it's in multiple languages. There are at least 10 different languages. So like I said, if you will give me your cards or what have you, I will be more than happy to reach out on your behalf.
Thank you so much. This is so important. And part of the work we did over the past 3 years with the funding that we got, and we'll continue to do it no matter what, is to actually develop webinars, develop seminars that are focusing on different aspects of, migration, migration and health, migration and mental health, psychosocial education. So we are very happy to continue this dialogue. and connect with as many of you as possible. Any other questions, comments? We'll take 2 more.
Hi, my name is Elena. I am a mom of transgender son from Russia. We are here with Rus LGBTQ organization. First of all, I would like to thank you so much for this very important issue is raised here as mental health. So we went through, with my kids, we went through all this hell, like suicidal thoughts, self-harm, all this stuff. So, and when we went here, we just escaped from homophobic Russia. And it was the only way for us to survive, for me and for my child. And I can't overestimate the help and support we got here in the States for me and my kid. And thank you so much again for doing this great job for us, for all of immigrants. Thank you.
Thank you.
So, thank you so much, Asia. What is your name? Olive. Oh, yeah. I wanted to add that most immigrants, when they hear ACS, meaning that they're coming to take your child. No. As soon, if you live in the shelter, this is not start now. This is since when I was in the shelter, since 2016. If you live in the shelter and your caseworker can give you a shelter letter saying that you live in the shelter, you have that letter, go straight to 66 John Street. You're gonna get a live voucher, meaning that you have your voucher, they don't require any income, and that shelter will never expire. The voucher will never expire. And for a life, I still have it. I get my voucher for my son on 2016 until he finished childcare, and now he's doing first grade. It will never expire. Anytime we hear ACS, meaning that they come to take your child, no. Please, social worker, give them the shelter letter and give them the address, 66 John Street. So free, take the train and go there and get the shelter, the voucher. It's free for them. It doesn't matter your status, you immigrant, you just come yesterday, last night, they will give it to you. Thank you.
Thank you so much. And I think, Marty, I will need you to make sure that that information is translated for our group here, because they are in need of childcare. So that's definitely, and we need to put it up on the website. Okay. So any other questions? Last one, and then I would like us to wrap up and take some things, to think of, and also give you some chance to look at our resources.
Just, there's been a lot of talk about coordination of services. So it's like, how can we do that, right? We don't want to just talk about it. We want to make it happen. And also just something that was brought up during the employment part was the worker cooperatives, which I think are just incredibly empowering for people. So if people aren't aware, so much of them, I know certainly in Brooklyn and like in Sunset Park, there's a number of them that are very active. There's the workers, what did I just say? The Workers' Justice Project is another place that's a good place to tap into. So yeah, empowering each other.
Absolutely. And, we are very proud and totally not biased of our work and the website that was put together with the contribution of so many amazing minds. So if you go there, if you can look at the resources, you'll see that you can go there and find resources and then find them in different languages, right? So also for all the rights, the explanation of rights, the psychoeducation programs, they are all translated in English and Russian. We are now working on translating everything in French. That's how we start coordinating. That's what we can do. And that's where I think our role as universities comes in. We want to make sure that we create a space where all these voices can come together. So as we are closing, we heard a few themes throughout this whole 3 hours and a half, amazing event, I think, again, not biased. One is asylum a right? And I would say that yes, by international laws and by US laws, asylum is a right. meaning that everybody has the right to apply for asylum. That means that a right space needs to be created for people to apply for asylum. Are countries and governments obliged to provide asylum to all? No, they are not. But what they have to do is to make sure that the right to asylum is respected. Is employment a right? We heard that, like by what we see, is not treated as a right. But I would caution us because we need to keep thinking this is a right. And if it's not treated as such, there is work for us to do. The fact that people that are working because they need to survive and they do not want to depend on the government aid that we accuse them falsely that they depend on is called illegal work or is associated in any way with illegal activity is a problem. The fact that them trying to survive by themselves and work and be productive can be used against them when it comes to their asylum cases is a problem. And through the dehumanization of others, Paul Freire was saying long, long ago, long before me, we are dehumanizing ourselves. So asylum is a right, employment is a right, is health and mental health and access to health and mental health care a right? Absolutely. And if we don't treat it as a right, and we don't, we treat healthcare for anyone in this country as, a privilege. But it's not, it's a right. And just because policies did not reach where they should be, and just because, I'm sorry to say, the United States is lagging behind most of the world in signing any human rights treaties. I mean, we managed to sign, 5 out of the 18 major treaties? That's not an excuse. And we cannot say that these are not rights because then we gave up and we gave in. So when I hear voices like the ones we heard, people that are on the front line, working to address these issues, and still keeping hope, and challenging us to do something, to come together, to coordinate, to learn from each other, I know that we cannot just give up or give in. So if all these are rights, let me not forget the other one, very important one, is the right to housing a right? Well, by New York City and New York State Constitution, we are very good on that. The right to housing is a human right. And the right to housing does not only mean having a roof above your head. The right to housing does not mean being in a place where you have no access to resources and no ways to relate to others, to integrate, to be the productive person we want you to be. So if all these are rights, the next question I want us to take with us is, what are we going to do? How is this changing our practice as social workers, as lawyers, as healthcare and mental health care providers, as regular people, as policymakers? What does that mean? Well, when we agree that these are rights, there is no negotiation around that. A right is a right is a right. So now all we have to do, not that this is a simple task, is to identify where are the barriers that are preventing us from preventing and from protecting and realizing these rights. And then start chipping away at the barriers. It's not easy. It will not happen overnight. But the fact that, immigration is at the federal level. We cannot change anything at the state level, but nothing much changes at the federal level with all the hope we had. And now, 2 weeks ago, we just stumbled over a new barrier, the new asylum ban, where people now have to apply in a third country before they can apply in the United States for asylum. That's a problem. So we need to start dismantling all these barriers by working together and by bringing at the center of all of our work the voices of amazing people, amazing women that are resilient. But it's not fair to just count on their resilience and let things go on as they are. So please take this with you. What can we do together to make sure that we take the barriers away and the rights of migrants, as the rights of all of us, are respected, and we are treating everybody the same? Happy International Women's Day. We do have resources. Please go and ask about our resources. You will see more on the screen here. We'll be happy to talk to any of us, and thank you for spending this day with us.